All right, we're going to reconvene our meeting. We're on agenda item number 22, related to the county's harm reduction strategy. We have a few public speakers left. We're going to return to, I believe we were at Kathleen Lippett. Ms. Lippett, we are going to restart your time and give you your full time, and we will hear from the rest of the speakers, and then we'll have board deliberation on this item.
Kathleen, if you didn't catch that, we're going to restart your time at 2 minutes if you'd like to proceed to commenting on item 22.
Yes. Good afternoon, Supervisors. Kathleen Lippett here. A recent article in The Guardian, a respected English newspaper, highlighted many of the marijuana legalization problems in California over the last 5 years. They reported that experts state that 80 to 90% of the marijuana market remains underground due to a combination of failed enforcement efforts and a naive hope of regulating an industry that profits from drug abuse and addiction. Marijuana businesses, unpermitted and permitted, use their deep pockets to influence local, state, and federal government leaders, as well as the regulatory support structures behind them. The illegal businesses today are the fifth largest economy in California and increasingly have the capitalization to purchase legally permitted businesses. Today, state licensed businesses state that they must keep 1 foot in the illegal industry, unlicensed markets, to stay profitable. In the meantime, there is no recognition of the first-order victims, the young, the marginalized, and the low-income minority communities devastated by rampant drug dealing, drug abuse, and addiction. We should remember that today's marijuana pot shop applicants still prefer going back and re-victimizing those same low-income and minority communities. Thank you for letting me speak.
Thank you. Now hear from the next caller.
Hello, this is Ann Riddle, District 3. I wanted to share a perspective of a person who was around when the Prescription Drug Abuse Task Force was originally formed. This was as the result of the work of an aide in Pam Slater Price's District 3 office who was working with parents who were discovering pieces of foil in their neighborhoods, which turned out to be OxyContin pills that had been melted and sniffed by our teenagers. The whole 56 corridor seemed to be the focus of this problem for parents and their families and our teens. And law enforcement was also discovering that illegal activity by this sector of the county. And from this, District 3, Pam Slater Price's leadership, the Prescription Drug Abuse Task Force was formed. I share this perspective because I was on the original task force, and I applauded then, and I do again, the parents' observance of epidemics in the making because they're usually the first to see it and to understand what it looks like within their own families. I have called in before the Board of Supervisors because I've been trying to suggest that we have another teen epidemic, and it's marijuana use because of the high concentrates that are being sold in marijuana stores throughout the county, online and by delivery. And my great concern is the county considers enabling more marijuana businesses to come this time on the backs of the people in the backcountry, the problems we'll see as a result. Thank you for letting me share this perspective.
Thank you. We'll now hear from the next caller.
Terry Ann Skelly, item number 22.
You may proceed.
Hello, can you hear me?
Yes, we can. You may proceed.
Okay, thank you. Good afternoon, Board of Supervisors. I enjoyed the update provided by the county's behavioral health staff. Those of us working to reduce or prevent alcohol, tobacco, marijuana, and drug problems, especially among youth, recognize how mental health problems also coexist with substance abuse use. The Union Tribune article on November 28th entitled "County Focuses More Attention on Mental Health" announced its plan with Rady's Children's Hospital to treat young people with mental health issues through a plan to establish a youth hub. As you know, Rady's Children's Hospital, and I emphasize Children's Hospital, had opened a 24-bed inpatient mental health unit 3 years ago, which has been fully full from the beginning. During the pandemic, a new psychiatric emergency room called the Copley Psychiatric Emergency Department was added. The Union Tribune also quoted a volunteer with the San Diego chapter of National Alliance on Mental Health, a nonprofit advocacy group that provides resources and counseling to families affected by mental health issues. She called out the intensive need for care after mental hospitalization, the enormous task that care is. For those of us family members who are on the front line of children's, and again, children's, I emphasize children's mental health care, we must not underestimate the role that marijuana plays in exacerbating mental health problems for children and their families. Any county proposal to enable more marijuana storefronts will have an unfortunate impact on children by promoting and normalizing its use. Thank you for your consideration, because our children and you can ill afford any more adults' insensitivity to the mental health needs of our youth. Thank you.
Thank you. Chair Fletcher, that concludes public comment on this item.
Thank you. Item 22 is, I feel like a good news story in that we are moving forward. We know we have a ways to go. We know we have a lot more to do when it comes to meeting the need around treating substance use. But we are moving in the right direction, and I think it's a considerable swing for our county. I first brought the item forward in March of 2020 to have us develop a comprehensive harm reduction strategy, and we couldn't get enough support to pass it. And so we brought it back in January of 2021, and now we're beginning to see it moving forward and be implemented, and I'm encouraged by where we're going in terms of changing attitudes around meeting people where they are and providing things that we know work. And tackling the issue, both destigmatizing the issue of addiction and treating it for what it is, which is an illness. We obviously want education and prevention on the front end, but we know that some folks are going to be prone to addiction. And for those that are, we want to have the very best available services to help get you off of that substance, to help you work through, to protect your health and the overall public health. And so I think, we're moving considerably in the right direction. I'm particularly encouraged by the increase in numbers around case management. Seeing those case management numbers increase, that's how we help sustain folks in an ongoing continuum of care that can really get them out of the episodic relating to a period of crisis and truly get them on to truly living well. I'm also incredibly encouraged to see the increased percentage around intensive outpatient. We know that, again, that is that ongoing care that is going to give folks the best opportunity and chance. The rise in I always mess it up, buprenorphine. I don't know why I have trouble saying that. The increase in our jails in medication for addiction treatment, we know is a critical component. The naloxone efforts, I would encourage us to be more aggressive in getting those out. If we have them, we got community partners, members of the public. I mean, anyone having those is a good thing. And so we want to be more aggressive. I think the more of those that are out and present in the community is good. Efforts around syringe services, again, doing the assessment, figuring it out right. One of the single greatest programs to actually get people into rehab and actually get people into treatment. The CHEART teams, the safe haven efforts, all of these things are really coming together well. We know that everything we've been through in the last few years have increased the strain and stress on folks. We're aware that the number of fentanyl, the rise in availability of fentanyl's presence, and the fatal impacts that can have. But we've also, over the last few years, in dealing with that hardship and difficulty, have learned some things. And I think there's some powerful lessons learned about telecare and the ability to connect people where they are and the settings where it isn't always the best option. Sometimes it needs to be in-person care. But if we can keep some of that expanded access to drug treatment services with telehealth and expand our in-service care, then we're really increasing the capacity and reach that we can have as a community. And so, all of that, the Palm Avenue Wellness Center, our BHS staffing is really important. And then the final point is just the effort we're doing around behavioral health workforce in general. And I've been very involved in that. We've got an incredible group of folks assembling, working hard. I appreciate the role Workforce Partnership is playing, our behavioral health services team is playing, to really come up with strategies. What are short-term things where we can immediately boost the workforce across spectrum? What are kind of interim steps we can take? What are long-term steps? because that is going to continue to be one of the barriers holding us back, is just a shortage of available workers in this space. And so I think all of these efforts, again, are moving in the right direction. It's not fast enough. It's not enough. We've got to go quicker. We have to do more. But I think that it is headed in the right direction, and I'm really pleased with the update today and the work that's being done. And so with that, I'll make a motion to approve the recommendations in item 22. May I ask a second by Supervisor Lawson-Remer? And with that, I'll go to Supervisor Desmond.
Thank you, Mr. Chair. Appreciate it. I got a quick question, I guess, for Luke or the presenter. On slide 10, there's a chart there that was way too busy for me. I couldn't figure it out. I don't know if,
Yes, Supervisor, this is my favorite slide.
this is your favorite slide. It's very colorful, but and it's over the same time period. I'm just trying to. Can you put it up at all, or? So working on that. Okay. So we're over the same time period.
Correct.
What's there's a left one. I can't. The left one and the right one. I know the colors. I can read
Right.
the one's telehealth. There's phone. Others, but why is they're dramatically different?
Yeah, I'll start, and then maybe Dr. Esposito if I miss anything. So the one on the left, the one with relatively more teal, includes that reflects service volume across all services that are part of our substance use disorder treatment system. So including residential treatment services, of which there are many. The one on the right, that is a little bit more granular, right? That reflects outpatient service volume. So you see, it would stand to reason that in the outpatient space we would have more telehealth, right? Because residential settings are by definition in person. On the outpatient side, we see much larger yellow and orange sections of those bars because that's where we've transitioned primarily to telehealth contact or telephonic contact.
So when you say they're residential, so
Yeah.
and these are out. Residential and outpatient are, I guess, to me synonymous, but
Oh, yeah.
they're not. Okay.
They're more. They're not antonyms exactly, but they're different. So residential is treatment that happens in a sited location devoted to treatment.
And that's on the left.
That's on the left.
Okay. And the one on the right is non-sited.
That's right. So and on the well, it can be cited, but on residential treatment, the expectation is that people are sleeping in the treatment setting.
Okay. So what does this tell us?
Well, this tells us, first of all, if we focus on outpatients, well, to just review how Dr. Esposito went through it, and I should probably let her do it, so I will in a second. But
She's anxious. I can tell. She's leaning into the mic.
But I do love talking. So it shows just a couple things. One, increased service volume overall between the establishment of DMC and the onset of the pandemic. If you look on the left, you see that going up, 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 up. And then with the onset of the pandemic, it goes down. Okay. And so one point that Dr. Esposito is making, and I'll hand it to her now, is that overall, since the establishment of DMC before the pandemic, we saw good increases in service volume, which we would translate as increased access to care. Go ahead, Nicole.
I don't have a lot to add other than just, offering it perhaps another way, is thinking that over on the left, all of our levels of care, and the subset is on the right, which is just the outpatient. And the residential, think of it like a 24-hour facility. We sometimes use the word inpatient, though it's not like a hospital setting. It's more like a home setting that's considered inpatient for residential level of care. And outpatient is more like going to the primary care doctor, but it's a full treatment program, and it's in a clinic setting.
Okay, it's clearer. Thank you. I don't know if I got 100% yet, but so this is a good thing. The trend is good that we're getting a lot more people receiving the care, whether it's outpatient or residential. Okay.
It's good, and it shows a transition that's really dramatic to telehealth. And what's significant about that is that infrastructure, which was supported with CARES Act funds that you all enabled, that will over time increase our capacity to help more people access care, because it's another way that people can get into care. One of the things we say is if you have access to a phone, you can get access to care.
Oh, that's very nice. Well, I want to say thank you very much for the presentation, Dr. Esposito. And you know, for the record, and I realize this was not part of the presentation today, but overall with the harmful substance issues we're trying to tackle here. And I know that needle exchange programs weren't part of it today, but I just want to state that I still do not support any of the needle exchange programs. However, I am interested, and I know there's going to be outreach to community members about what they think about these types of programs within their communities, within the community assessments. So I'm glad you're doing that outreach to kind of before implementing it to find out what they care and what the community cares and thinks about those types of programs. I support the naloxone distribution and the contract with Palm Avenue Wellness and the Recovery Center and the work being done with our MAT program and how to improve our overall health and well-being of those diagnosed with substance abuse disorders. So again, I'm looking forward, very forward to the fentanyl awareness campaign. Unfortunately, I'm going to be doing an adjournment at the end of the meeting today of someone who's a victim of fentanyl overdose. So we've got a lot, way too many people dying of fentanyl overdoses, and I'm, looking very anxious to where that hopefully that gets launched in the near future very quickly. So thank you so much.
All right, we've got a motion by myself, seconded by Supervisor Lawson-Remer. Not seeing any other requests to speak. Please vote.
Chair Fletcher, that motion passes unanimously with all supervisors being present and voting aye.
We're going to take item 26 next. We have a couple folks involved in this item who have commitments this afternoon. We want to get this one done, and then we will pick up the rest of the agenda in order after that. Before we go on to the next agenda item, we're going to review the rules of procedure. The rules of procedure do not allow you to interrupt the proceedings of the meeting. That includes clapping and stomping and other noises. That includes outbursts. If we follow the rules of procedure, then we'll all be here in person. Everyone will come to the podium, they'll say what they have to say, and everyone will have that opportunity to do it in person. If you do not follow the rules of procedure, you will be removed. If we have disruptive situations where individuals who don't want to be removed, we will immediately transition this meeting into 100% virtual, and everyone who wants to speak will have to dial in on the phone line. Now, I would much rather not do that. From the beginning, I've said we want to have an environment and a place where people can come and speak in person and be here. And I've always worked hard to allow that to happen, but you got to follow the rules of procedure. So if you do not, then you will be ordered to be removed. And if we get in a situation where people won't comply with the law enforcement deputies having you be removed, then we will adjourn this meeting into a virtual meeting completely, and we will conclude our business in the agenda virtually. I'd much rather that not happen, but that's really dependent upon each and every one of you adhering to the rules of procedure and not disrupting a public meeting. With that, we're going to hear a presentation on agenda item 26, and then we'll go to our public speakers. I'll turn it over to staff at this.
Thank you. I'll just give a moment to pull up the presentation. All right, thank you. Chair Fletcher, members of the board, today I am pleased to provide an update on our regional economy, the latest retirement valuation, the recently completed audited annual financial report, and our current year budget performance. This slide deck here, it may look new, but it is the same COVID economic impact metrics reformatted with just one addition: inflation. It's something that we've discussed in the past and we will continue to monitor. And as you can see, year-over-year inflation is up 6.5% here in San Diego. Price increases distress our most vulnerable communities the most because they have the less disposable income. This especially impacts those in the 4 sectors that account for 85% of the job losses in our region suffered since the start of the pandemic: tourism, retail, education, and professional services. Mobility metrics have significantly recovered and started to stabilize after hitting lows in April of last year, with foot traffic and domestic air travel down 27% and 96% respectively from their baseline. And while these metrics are yet to fully recover to their pre-pandemic levels, people have not stopped spending. Consumer spending dropped 37% in April of 2020, and since then, we've not only fully recovered, but we're outperforming pre-pandemic levels by 17%, so very strong there. Tomorrow, the U.S. Bureau of Economic Analysis will release the 2020 gross regional product numbers, so we'll know for sure how much the local economy here changed. SANDAC had been predicting that COVID had a $7 to $10 billion negative impact on our local economy, which is roughly a 3 to 4% drop. And so for context, when the gross regional product numbers are released, it'll be helpful to note that the same hardest hit job sectors accounted for roughly half of San Diego's economy in 2019, so we'll be watching for that closely. With that, we'll quickly look at these sectors in more detail with job losses by sector, which are indicated here at the top of this slide. As it relates to unemployment rates, the most recent data available continues the positive downward trajectory that we've seen over the last few months at every level, but San Diego still is not back to its pre-COVID levels of unemployment. School reopenings are allowing more education in the education sector, rather, to get back to work, and that's good news. But currently, we do have a labor pool that's still smaller than it was prior to the pandemic, and there are about 83,000 San Diegans that are still looking for but unable to find work here. As we prepare for the release of the governor's budget next month and its anticipated impacts to the county, the recently released outlook by the Legislative Analyst's Office, or the LAO, is not surprisingly reflective of the strong economic recovery that's underway. A few critical highlights of the report include the fact that the LAO believes that there is capacity to increase investments in spending or to make tax cuts. For the coming year, the LAO is in fact forecasting a $31 billion surplus for the state during the next budget, as well as a $3 to $8 billion ongoing surplus annually thereafter. The forecast is being largely driven by growth in state revenues, including personal income tax, corporate taxes, and sales tax. Due to the pandemic, revenue in these categories have been volatile, and as such, the LAO has taken a moderate approach in its analysis, meaning that it's possible that these amounts may be understated if economic conditions continue as currently underway. However, the LAO report does not take into consideration the potential impacts of continued inflation or the new variant. So what does this all mean to the county? Well, we probably don't need to brace for any cuts from the state, and we can be optimistic about potential funding increases from the state. These favorable economic conditions are also helping to bolster the county's revenues, specifically our property tax revenue, which is driven by activity in the housing market. This chart shows historical assessed value for the last 15 years, which has grown by 4% annually on average. Heading into 22-23, we anticipate assessed value to perform above that average with a growth rate of 5% and 4% each year thereafter. County staff works with the assessor, recorder, county clerk's office to estimate the assessed value for the upcoming budget and future years for planning purposes, and we appreciate the real-time data and projections that are provided by the assessor's team. Moving on to retirement, as we've discussed in prior updates, retirement costs are a significant driver for the county, and therefore we monitor this indicator very closely. Last month, the Retirement Board received and approved the June 30th, 2021 actuarial valuation, and that new valuation results, those are in alignment with the estimates that I presented to your board back in August, so no surprises there. This slide provides a summary of key indicators from the valuation in comparison to last year's report. In a nutshell, SDCR's investment income is going up and the county contributions are going down. This is evident in the table where you can see the funded ratio and the unrecognized investment gain going up, and the unfunded actuarial accrued liability, or UAAL, and the average employer contribution rate going down. These changes are primarily due to the 25% market return that we experienced, or the fund experienced last year. So next, I'd like to update you on the recently completed financial statements for the county, specifically the June 30th, 2021 balance sheet. This slide includes this year's most recent balance sheet data and last year's data for comparison. Overall, fund balances in the general fund have decreased by $2.5 billion, or from $2.5 billion, excuse me, to $2.3 billion. You can see that at the bottom line here. I'll briefly define the categories that show up here on the balance sheet, which are in the far left column. The not liquid category represents non-cash county resources, such as inventory, supplies, and loans that are being repaid to the county. The specific legal use category of fund balance is where a law or government code requires the county to use a revenue stream for a particular purpose, and these funds can only be used for their legally stated purposes. Next is earmarked, which is a grouping of fund balance by which the board has taken specific action, usually through the budget process, to spend funds. Examples of earmarked funds include construction projects and service contracts, and these are activities that generally cross multiple fiscal years. And then the last category is the general fund reserve. Through the administrative code, the board has used this designation to account for emergencies, economic volatility, and mitigating long-term risks. You'll note that there are two subcategories here, the general fund reserve minimum and available general fund reserve. The general fund reserve minimum is the amount required to be maintained as a reserve by the administrative code. The second subcategory, available general fund reserve, is the amount that's in excess or in deficit of the reserve minimum. Focusing on the overall general fund reserve, which changed the most materially between the 2 years, you'll note that the total amount has decreased from $708 million last year to $661 million this year. According to the current administrative code, the county is required to maintain a minimum general fund reserve, which increased from $717 million last year to $836 million. In comparing the new general fund reserve of $661 million to the minimum of $836 million requirement, the county fell short of meeting its minimum reserve target by $175 million. While this wasn't completely unanticipated, it's significantly greater than the $64 million that was expected when the budget was adopted. This higher than anticipated shortfall is being driven by unexpected delays in reimbursement for FEMA for COVID response activities that occurred last fiscal year. While we anticipate that FEMA will reimburse the counties for last year's costs, which will help towards restoring that minimum, the risk of reimbursement delays may constrain our balance sheet going forward. And I will continue to update your board on this subject as we get additional details on timing expectation for reimbursement. And I'll note that the board's finance subcommittee is actively engaged in reviewing the county's general fund reserve ordinance. With all of that as background, I'll now turn our attention to the county's current year budget performance. The county's projecting positive results from budget for all funds of $147.6 million. This includes $40 million that's outside of the general fund, which I will talk to you about in more detail on the next slide. This slide here focuses on the projected expenditure and revenue variances for the general fund. Expenditures and revenues combined for the general fund reflect an overall positive variance of $107 million, which is the equivalent of 1.5% of the total general fund budget. This 1.5%, I'll note, is below industry metrics, which range from 2 to 5%, and should generally keep pace with annual budget growth. By way of comparison, the general fund budget grew by 10.4% this last year, compared to a 3% average for the 10 years prior. So this metric here, it just serves as one of many indicators of the county's health and long-term solvency, so we monitor that closely. The projections presented today, as noted in the blue boxes, assume that spending will be below budget by $123 million and that revenues will not meet the budgeted levels by $16 million. The fund balance overall that's being generated is concentrated in three areas, primarily in the Health and Human Services Agency, general purpose revenue, and in the public safety group. In the Health and Human Services Agency, amounts are concentrated in behavioral health services and largely driven by one-time fund balance that was budgeted to bridge fund services for a year while we were looking for sales tax revenues to recover, but due to the economic conditions, it's not anticipated to be needed. The better than anticipated general purpose revenue that you see here is primarily due to the better than anticipated assessed value growth. We built the budget with an assumption of 3%. It came in at 3.72%. And we've also experienced higher pass-through and residual revenues from former redevelopment areas. These unanticipated general purpose revenues have already been incorporated into our outlook for the upcoming budget cycle. And in public safety, the results were concentrated in the Sheriff's Department, driven largely by salary and benefit savings from vacant positions and normal attrition. The general fund projections assume continued spending towards the COVID-19 response activities. The county's weekly spend rate for its COVID response remains very close to the level that was last reported to your board, which is now $4.9 million. FEMA funding, previously scheduled to end on December 31st, has been extended through the first quarter of next year, so that's good news. The percentage of funding for the COVID response activities is now about 50% for FEMA eligible activities, with the remaining 50% being covered by ARPA funds. This weekly spend rate reflects the incremental increases in spending related to ARPA, as well as decreases in spending categories eligible for FEMA, such as public health hotel rooms. Given FEMA reimbursement is uncertain after the first quarter of next year, as well as concerns that I've mentioned regarding timing of FEMA reimbursement and response spending lasting longer than was anticipated, the ARPA response contingency funds that we have set aside should be maintained to draw upon if needed. Now we'll talk about variances from budget outside of the general fund, which represent $40 million of the first quarter operating results. The majority of this variance is concentrated in our special revenue funds and reflects better than anticipated sales tax receipts in the Proposition 172 Special Revenue Fund, as well as lower than expected expenditures in the Departments of Public Works and Library due to staff vacancies. These projections reflect a negative variance in the county's Public Liability Internal Service Fund due to matters that were resolved at amounts greater than anticipated, as well as additional settlements that were reached in the current fiscal year. The specific action and the recommendations that we have before the board today include recommendations that would increase the total budget by $16.4 million, including a decrease of $3.5 million in the general fund, and will provide authority to make other adjustments that do not increase the overall budget. As we close today's presentation, there are some key topics and issues that we'll want to keep in mind as potential risks and opportunities moving forward. In this economic recovery, we have certainly seen high unemployment and higher than expected inflation. This may lead to ongoing struggles for small businesses as they have to raise wages to satisfy the shortage in labor and try to match wages with other firms. And we also know that price increases, again, hurt the most vulnerable of our San Diegans. The overall rise in asset prices in the stock market has certainly helped the county's retirement fund to perform very well last year. But when it comes to pension systems, we don't necessarily get excited just about one good year, just like we don't get irritated about one bad year, because we know that we're in this for the long term. And this is why SDCR amortizes their gains and losses over multiple years, because retirement and performance is about the long term. But your board will want to take note of retirement board changes to demographic or economic assumptions, which will be considered this spring by the retirement board. These changes or potential changes could change the cost of retirement for the county, depending upon which assumptions are ultimately adopted by the retirement board in their June 2022 valuation. As always, county staff is grateful to this board for providing us with a roadmap for providing services to the region in this challenging economic environment, and we will continue to advance your board's framework as we receive additional input on the state budget and major federal legislation with local impacts. Subject to your questions, thank you for your time. That concludes my presentation.
Thank you. Let's go to our public speakers.
We have two requests to speak on this item, both in person. I'd like to invite forward Audra and Robert Wellstand. You'll have 2 minutes to address the board. Please state your name for the audio record.
Robert Wellstand, thank you for the Budget Office for its analysis. It's highlighted a key point about county revenue and spending of our property taxes. Proposition 13 limits the increase per year to 2%, but homeowners of 30, 40, and 50 years are not being able to keep up with the exponential growth curve in the tax burden. If you look back 15 years, which is what your slide did, it shows what looks, like a linearly increase. But if you look over 30 or 40 years, it's actually an exponential curve. And people's incomes in retirement are not growing exponentially unless they're wealthy people who can afford to buy into these stock market and things like that. So the mainstay of people in San Diego are falling behind, and it's actually causing homelessness in this county. So you guys like to spend other people's money, but you realize that not everyone can afford you spending the money the way you're spending it. The high cost of living in San Diego can be related to the high tax burden on homeowners and renters who get their tax increases passed to them through the growing rents, despite rent rate cap increases that are mandated by city and state. People are getting priced out of affordability to live in this county. Their homes are just too overpriced, and the taxes are just too high. If you really want to help the homelessness problem, drop the taxes. Don't increase the spending. Thank you.
Next speaker, please.
That'll never happen. Audra, love just seeing what you guys love to spend money on. You don't even consider where that money comes from. You just like to spend it. Burns a hole in your pocket. And it's sad because you're paying the sheriffs quite a bit of money. Know whose side they're on because of that. Because they're not doing what they took an oath to do, nor are you guys. You're constantly violating the Constitution, federal statutes, your oath of office. And you're arresting people for clapping. You know that's kidnapping, right? For clapping. And yet all of you sit up there on your pedestal and act like, oh, the rules are for thee, but not for me. I'm going to murder people. I'm going to force them to inject themselves with a bioweapon, telling them it's all for safety. Yeah, look at the time. I got a minute left. It's disgusting because I was even assaulted by your staff, Nathan. It was on video, and they were supposed to do a citizen's arrest. And what happened? Nothing. Did the DA pick it up? No. And then you arrest a woman in here for clapping? I mean, look at what kind of a state of emergency we're in. All of the tyrants need to go. You should be arrested, not people for clapping. And you violate your own rules all the time. So you're going to sit here and be like, you got to follow the rules that we just made up, just so we could silence you guys. All while we violate every freaking law that there is. And yet you're still sitting there. Your time is coming. I cannot wait.
That concludes public comment on this item.
Thank you. Supervisor Desmond.
Thank you, Chair. Ebony, I just had a couple of questions, and I know this is the second time I've seen this, but a question on the general fund reserve, where we're down $175 million. But you had mentioned that we're behind, or FEMA's not paying us on time. If FEMA were to, let's say, pay all the way up to what they've promised or what they were supposed to pay us, where would we be if that was the case? Is it we'd still be, I don't know, where would we be instead of the $175 million short?
Supervisor Desmond, thank you for that clarifying question. The amount of FEMA reimbursement delay that's impacting this negative $175 million is $125 million. So we would basically be $50 million short still of our minimum, but the amount of the unanticipated delay was roughly $125 million.
And you had budgeted to be short about $64 million, primarily because of COVID and everything else that happened. So of the $50 million that we're going to be short, what's the plan to make that back up or get us back to our required minimum?
The plan is a 3-year plan to restore the minimum based on operating results. So the results that we have today, for example, the $170 million in the general fund would go towards replenishing that shortfall.
Okay, all right. Thank you very much. Great presentation. Really love to see that I know it's a lot to do with the stock market, but I guess the fund balance or the amount that we have, let me get the terminology right, the funded ratio of the pension fund at 80%. It's a good number to see, and thank you very much.
Thank you. Supervisor Lawson-Remer.
First of all, I just really want to thank you and the team for excellent work. I know how challenging it is to keep this budget on track. It's a massive budget, and it is just incredibly impressive that we're only at 1.5% deviation. That's very, very good. So thank you for all of your hard work. I just had a couple of clarifying questions so I could better understand what I'm reading here. The first was actually referenced in your presentation, that the largest variance came from, I think it was approximately $40 million in additional sales tax revenue that is directed to public safety through 172 funding alignment. Am I correct? Probably didn't capture that exactly, but that was the slide I thought I saw.
Thank you for that question. Actually, you got that just right. As a part of the balances that are outside of the general fund, we're projecting $40.5 million in various areas. That includes the amounts that are in the Proposition 172 Special Revenue Fund, which is approximately $45 million higher than anticipated.
And the Proposition 172 Special Revenue Fund, how is that allocated? Like, what is the statutory, I mean, is it allocated by the state according to statute or by us here locally?
I'll let Holly chime in on this as well, since this affects her group, but the amounts are required to be used for public safety activities. There is a board policy in place that determines the distribution of those amounts, and I believe it's 70, 20, 10 between sheriff, DA, and probation.
Sorry, so what's the distribution?
Go ahead, Holly.
Supervisor Lawson-Remer, it's 70, 20, 10, so 70% to the Sheriff's Department, 20% to the District Attorney, and 10% to probation. That's how the growth in the fund is distributed each year.
So the public defender doesn't get anything?
No, and that's based on history of the proposition. So when voters passed that proposition, it was because the state came and took county tax revenue. And so those funds were distributed according to how those tax dollars were allocated at the time. So for example, fire was not receiving those property tax dollars, so fire doesn't get any of the Prop 172 funds. So it was meant to backfill the state coming in and taking property tax, and they replaced it with sales tax. So the county at the time formulated a policy that would backfill essentially what the state took, and that was the allocation distribution among those departments.
Got it, so helpful. So fire and fire, EMS, and PD don't get any. The sheriff gets about 20%, I mean 70%, probation gets 10%, and the DA gets 20%.
Right, 70, 20, 10, and that was just based on the historical, what the voters voted on the additional sales tax to fund, to backfill those departments that lost the state money because the state took it back in the early 1990s.
Okay, so that means that then the sheriff will get an additional approximately a little under 30 million of this additional revenue. Is that correct? There's 40, I mean, that's very back of them, like a 28. I should ask Ebony to do the math, not myself. But am I about right?
That's about right, yes.
It's about 30. So then I guess the question is, I know what you were doing with this quarterly budget adjustment was looking at whether there were unspent funds that had been allocated during the budget cycle that were not yet spent because, for example, they were for staffing or salaries or whatnot for positions that were not filled, so that the money wasn't spent because the person wasn't hired or whatnot. So what is the amount currently in the sheriff's budget that is that has not yet been spent that we would have been projected would have been spent by this point in the year?
Supervisor Lawson-Remer, the Sheriff's Department has a positive variance of $12 million in salaries and benefits, and that's from vacancies and attrition, and that includes for law enforcement, 176 in detentions, and of those, 123 are Rock Mountain positions for total sworn of 180 and 350 professional staff.
Okay, so they're about 12 million over what they need, and then we're going to give them an additional 30 they didn't anticipate. So it's sort of 42 million extra money for the Sheriff's Department.
Supervisor, so they do have a plan for spending the funds on various projects. So, for example, with the Prop 172 funds, they look at it from a 5-year perspective and what's budgeted, and they have specific projects that they have identified for that. And then for the fund balance that they're generating, they do have a number of projects, including making Wi-Fi available at all of the detention facilities is one example, but a series of projects that they were intending to
I'm sure they're all great projects. I'm just trying to better understand. These were not things that were in our initial budget because they didn't have the money. There are additional great things that the sheriff plans to do with the money.
That's correct.
Okay. It's helpful. So, I would be really curious to hear from our other public safety entities, particularly fire, EMS, and the public defenders, on whether there's sort of like other things they think are also great that they need to do in their own buckets that that they think would be useful if they had access to a percentage of that 172 funds.
And that, again, Supervisor, the distribution is a board policy. The 70-20-10 is a board policy, and we allocated it according to that policy.
Okay, no, I totally understand. I think I'm sure what the sheriff's plans are great. I would also imagine that the fire department has other great things that they need to spend money on, as well as EMS and our PDs. So I'm just want to make sure we're looking at equity in how we allocate our funds to support all of our public safety entities. That was very helpful. So I think my next question is I had questions on number 17 and 19. Nothing wrong with your work. It's absolutely something wrong with how I'm reading. I just am not following if these are funds that are coming from the general fund or if they're funding sources that are earmarked, particularly earmarked for these sources, because these are pretty significant amounts of money.
So recommendation, I'll start, and then I'll let Holly chime in because these are both public safety related capital projects. Recommendation number 17, Supervisor, is related to the Youth Transition Campus. And the action that we're taking here is to consolidate the first phase and second phase of the project so that they're just one capital project, but also to address cost escalation that's occurred with the project, phase 2 specifically, due to current market conditions in terms of cost escalation for materials and supplies. The bid came in higher than we were anticipating. So $5 million of additional resources are being brought in from the local revenue community corrections subaccount. And those are program revenues that are available to support this project, and that's the Youth Transition Campus. So that's no direct general fund balance impact, if you will.
And what were those funds allocated to prior to being reallocated to this project?
It was, Supervisor, it was fund balance in the community corrections subaccount.
Okay.
And I'll ask Rosemary to come to the podium in case I get stuck on any of these questions.
So that was funds in that subaccount. So we're taking it out of the subaccount and using it to pay for the increased cost of construction.
Yeah, that is correct.
And and what is the percentage increase that we have to pay the additional? What's the percentage?
percent of increase of, that we have to pay for the project? Is
Yeah,
that
the percent increase. So you said it was what was it? I don't see, you said 5 million additional outlays. So what is the percentage overrun on the project?
Roughly 6.5%. So the total of phase 2 is $75 million. So the $5 million is roughly 7.5%.
Okay.
This is concentrated on the construction portion of the bid, which is a smaller subset, but overall the contract is, or the cost of the project is $75 million for phase 2.
And what assurances do we have that they won't continue to increase?
We are completing negotiations now, so this is will be a firm fixed price for the negotiations, or for the construction.
Oh, this is fixed for the rest?
Yes.
So they can't go up anymore?
No.
Okay, great. And then my second question was similar on number 19.
Okay, so I'll start out with number 19, and Rosemary or Holly can chime in. This is more of a...
I mean, by the way, I'm not against any of these things. I'm just trying to understand.
Oh,
It
sure,
looks like
of
we're
course.
taking money from the sheriff's
Yes.
appropriation and giving 10 million to the fire department.
To this capital project. So this is the East Otay Mesa fire station, which was originally anticipated to be debt financed through a Melrose type structure. The Melrose structure was actually established before the rural fire protection actually came into the county. So this is something that was in place for some time, which is not uncommon for these Melrose type financings. The budget itself assumed that we would have $10 million of debt proceeds from the Melrose to support this capital project. As we began to execute the financing, it was discovered through the legal analysis with our financing team that there were constraints that would make this debt transaction unviable. So we had to pivot here to
Why?
find...
What was wrong?
Within what is called the rate and method of apportionment, which allows for taxes to be allocated to the respective property owners, there was language that would have allowed property owners to come back and not be allocated the special tax that's needed to pay the actual debt service. So we basically had no guarantee that the revenue stream would be available in the future to pay for the debt service, which meant that we would have had to change the structure of the debt in order to make it viable. So basically the financing structure just was no longer viable.
Understood. And is this appropriation, this 10 million from the sheriff's salaries, is this the amount of their fund balance? Is that where this is coming from?
This is coming from amounts that were going to generate fund balance within the sheriff. So the amounts that you see reported in the actual final report for the sheriff have already been adjusted to be reduced by this $10 million that's being transferred out of the sheriff into this project.
Okay, so top line, 5 million more money on a 6.5% increase from the youth construction of the youth transition facility, and it's coming out of the local revenue, their own sub-account that was already allocated, not out of general fund. 10 million to the fire department for this project that's coming from the sheriff's salaries that were going to be surplus, it was going to be balanced. And then 40.5 million that's being allocated, 70% sheriffs, 20% DAs, 10% probation, based on Prop 172 funds. And those are kind of our big ticket items, and everything else here is like an air conditioner. I'm exaggerating a little bit, but I'm just really focused on those because those seem like they're really big tickets.
Yeah, and I'll just add that in terms of the spin down, if you will, of that over-realized Proposition 172 fund balance, that action would have to occur through the budget or some board action before any of those dollars could be actually spent.
The 172?
Yeah, we would need to appropriate those resources.
Oh, because those are not appropriated by our action today.
No.
Got it. Okay, thank you. Thank you so much. Thank you all, really, for all of your extraordinary work.
Supervisor, I'd like to just jump in really quick just to make sure it's really clear on item, I believe it's 17, the Youth Transition Center. We are still in active negotiations with them. So even though we believe we have this covered, we have some scope issues that we're still negotiating with them. So I don't want to leave the impression that we may have to come back and adjust this. And at the beginning of any project, we always know that there are scope issues. So I want to be really clear and not have you think that we would never come back. Hopefully we won't, but I'm just letting you know that. And then just also on the positive side of that, on phase 1 of the Youth Transition Center, we actually had additional funds left in that project, which we are also using to cover the increase in the cost of construction of phase 2. So I just want to be fully transparent in that.
And so it costs more than $5 million additional?
That's correct. The cost of the
6.5% is more than that.
So, well, we are applying some of those other funds to that.
And part of that's just driven by the significant increase in the cost of raw materials, is that right? Steel?
That is
concrete,
correct, absolutely.
Significant, unexpected increases in those.
That's correct.
Right, okay. Thank you. Good.
I'm good. Yeah,
Okay.
Thank you all.
Thank you.
Appreciate the thoughtfulness.
Vice Chair Vargas.
Thank you, Chair Fletcher. Thank you to the team for all the great work that you brought forward. I have just 2 questions, and one of them, the first one was related to staffing. I noticed that there's multiple departments had staffing savings due to vacancies within their departments, and as a result of these vacancies, are we seeing any major impacts to services work being performed in any of those departments? And maybe that's just a general question somebody can.
I would defer to my colleagues to answer those questions for the respective groups.
Or maybe if you can't each one of you answer, can you make sure that somehow that's being looked into? Because I think I'm asking you something that you may not have all the information for right now, but I just want to make sure that we're very mindful. How about that? That we're very mindful about how when there's resources and we're having an impact, right? Because sometimes we're all really proud of the fact that we're saving money, but then people have to do double, triple work, and that's not fair to staff either. And I'm sure you're all very aware of that. So I just want to make sure that that's a priority, because one of the things that I heard on the campaign trail was a lot of folks who were concerned about the amount of work that they had in casework, et cetera, particularly at the entry-level job positions. And so I want to be very mindful of that. So savings doesn't necessarily mean that we have a culture of, efficiency. So just putting that out there. And then it's better than me asking each one of you to give me a question. So I apologize for that. And then the next one is, as I was listening to Supervisor Tara Lawson-Remer talk about this, I also had been looking at this information and looked at, I think next year it'll be a little bit different because we have a budget equity tool that's still being looked at, and we're going to be figuring out what this, how we're going to use that tool to move forward in our allocation and our resources, et cetera. But I'm thinking about maybe if staff is able to provide a list of what policies are in place that may impact that policy, that budget equity funding distribution, right? So, and the allocation of those dollars. So for instance, on this particular policy that you mentioned, the 70, 20, 10, it'd be interesting to see what other policies are out there that we may have to look at in the future if we are really thinking about what does budget equity look like. So we're not just changing things immediately, but really thinking about long-term what the budget implications may be, and then connecting it directly to our budget equity tool. Yeah. Please. And I'm happy to support it. So do you need a motion? I'm happy to make a motion to support.
All right, thank you. We've got a motion by Vice Chair Vargas, seconded by myself. Not seeing any additional comments or requests to speak. Please vote.
Chair Fletcher, that motion passes unanimously with all supervisors being present and voting aye.
We're now going to go to agenda item number 23, our COVID update. I will turn it to staff for a presentation, and then we'll go to our public speakers.
Good morning, Chair Fletcher and members of the board. Today's presentation will feature our Public Health Officer, Dr. Wilma Wooten, who will provide a public health update. Additionally, David Estrella, Director of Housing and Community Development Services, will provide an update on the county's COVID-19 response public health hotel program. Now, please welcome Dr. Wooten.
Thank you, Gary, and good afternoon, Chair Fletcher and members of the board. The county is still seeing increased COVID-19 cases due to the Delta variant, primarily. Case rates remain high locally and nationwide. The Delta variant is still the predominant variant seen across the nation, as well as in San Diego County. The Omicron variant has not yet been detected in San Diego, but it is only a matter of time. To date, 18 states have now reported the new variant. Here we see the level of community transmission assigned by the Centers for Disease Control and Prevention, which can be found on their COVID-19 data tracker website. Currently, there are 4 levels of transmission: low, moderate, substantial, and high. As of Monday, December 5th, the United States map shows most of the nation with high transmission, or red. California and a few other states are assigned substantial transmission, or orange. There are a few states assigned to moderate transmission, or yellow. Looking closely at California, there is a mix of red, orange, and yellow counties, as is seen in this slide. San Diego is currently in the higher red level of transmission based on case rate and testing positivity. In the red or orange areas with high transmission and substantial transmission, respectively, CDC recommends that everyone, including fully vaccinated individuals, wear a mask in public indoor settings to help prevent the spread of the Delta variant and protect others. Now, this slide is presented to show the number of new cases reported by date of report since the state ended the blueprint for a safer economy and lifted most restrictions on June 15th. Approximately 3 weeks after the restriction lifted, cases began to increase to levels similar to what we saw in February of this year, before vaccines were more widely available. The increase after June was also largely due to the increased spread of the Delta variant. In response to this increase, the county COVID-19 T3 response team increased capacity to meet the testing, tracing, and treatment demands. Although the number of cases gradually declined in September, daily cases reported approximately leveled off until we began to see some increased numbers of reported cases in the last week. And as you can see at the far right, those 2 days the cases reported were over 1,000. Cases may continue to increase, and there could be a potential increase around the holidays and winter months. The new Omicron variant may also cause an increase as well, although it is still unknown what impact this variant will have on local and national transmission. This next slide shows the number of cases by age in the last 3 months from September 11th through December 4th. For that time period, most cases occurred among those 30 to 49 years of age, followed by individuals 0 to 17 years of age. The least number of cases were among individuals 65 years and older. As you'll see in a moment, the highest vaccination rates are occurring among this age group, and the lowest vaccination rates are among those groups with the most cases. To closer look at cases among children, this slide shows the number of COVID-19 cases among individuals in specific age groups from 0 to 18 years of age in the last 3 months. As we observed overall in San Diego County, the number of cases declined since the end of August, despite schools starting around the same time. In the last 3 months, most cases in individuals 18 years and younger occurred among children 6 to 11 years of age. Fortunately, this age group is now eligible to receive the COVID-19 vaccine. This slide shows the number of confirmed cases physically present at K through 12 schools during their communicable period for each week in the last 3 months. The communicable period is the time when an individual can infect others. The communicable period begins 48 hours prior to symptom onset with COVID-19 or 48 hours before lab collection date if they were asymptomatic. As known, or rather as shown by the blue bars in this slide, since September, there were 232 to 346 students physically present at K through 12 schools each week during their communicable period. Additionally, as shown by the green bars, there were 28 to 64 non-students physically present at K through 12 schools for each week. These data may be underrepresented because these numbers represent those who were interviewed. However, there are many students and non-students physically present at K through 12 schools while they are capable of infecting others. Since COVID-19 is infectious before the onset of symptoms, it will be nearly impossible to eliminate all risk of exposure at schools. The best defense is getting vaccinated to limit the risk of spread and of severe disease. Now, in the next several slides, let's talk about vaccination in San Diego County. This slide shows the significant progress that has been made by the numerous community partners and county staff to administer COVID-19 vaccine in our region over the past 11 months and 2 weeks. As of Sunday, December 5th, nearly 6.2 million vaccine doses have been administered in San Diego County. Since the last COVID-19 update to your board on November 2nd, the 5 to 11-year-old age group became eligible to receive the COVID-19 vaccine. On the bottom right, the eligible population of residents now includes 5 to 11-year-olds and was expanded to over 3.1 million people now eligible to be vaccinated. Over 2.6 million, or 85%, of currently eligible residents 5 years of age and older have received at least one dose, and over 2.3 million, or 75.7%, have been fully vaccinated. And the next slide, this demonstrates the importance of vaccinations. The graph on the left shows the estimated 7-day rolling period, or rolling average daily case rate by vaccination status in San Diego County residents since March 1st of this year. The case rate among those who are not fully vaccinated, shown by the top orange line, includes individuals who are partially vaccinated and those who are not eligible for the vaccine. The case rate for all county residents is also shown on the graph for comparison and is designated by the blue line. The bottom green line shows the rate for fully vaccinated residents. The last 14 days are shaded because illness from this time period may not yet be reported and vaccination status may not yet be known. From this graph, we can see that since March 1st, the case rate among those residents not fully vaccinated is consistently higher than the rate among fully vaccinated residents. On the right of this slide, looking at case rates for the week November 7 through November 13, there was an average of 23.1 cases each day per 100,000 not fully vaccinated residents, compared to 8.1 cases per day per 100,000 fully vaccinated residents. Therefore, the case rate was about 3 times higher for not fully vaccinated residents compared to those that were fully vaccinated. In this next slide, it shows the same comparison for COVID-19 hospitalizations by the date of hospital admission. A 14-day rolling average is used due to small numbers, and longer lag is necessary due to the shorter or the slightly longer time needed to collect more complete data on hospitalizations. On the right of this slide, for the 2-week period, October 24th through November 6th, the hospitalization rate among residents not fully vaccinated was about 28 times higher than the rate among fully vaccinated residents. That is almost 1 hospitalization per day per 100,000 among not fully vaccinated individuals, compared to 0.03 hospitalizations per day per 100,000 for fully vaccinated individuals. And in this next slide, it is valuable to also view the death rates by vaccination status. As shown on this slide by the date of death, in the graph on the left, the peak in deaths occurred around mid-September. This is later than the peak observed for cases in early August, because the time that passes between illness onset and deaths must occur. While the previous two slides showed the number of cases and hospitalizations per 100,000 people, these death rates are showing the number of deaths per 1 million people. For the same two-week period described for hospitalizations, October 24th through November 6th, there were 2 deaths per 1 million not fully vaccinated residents and less than 1 or 0.3 deaths per 1 million fully vaccinated residents. The ratio means that the death rate for not fully vaccinated residents was 7 times higher than fully vaccinated residents. Another way to say this is that fully vaccinated residents were 7 times less likely to die than not fully vaccinated residents for that 2-week period. Now, in this slide, a breakdown of vaccinations by age group is demonstrated. The overall percentage of the eligible population 5 years of age and older vaccinated, shown by the 2 top bars, is slightly lower than what is shown on the vaccination dashboard because this graph does not include individuals vaccinated by the Veterans Affairs or the Department of Defense. The Pfizer COVID-19 vaccine was approved for children 5 to 11 years of age, and vaccinations began about 1 month ago on November 3rd. As of December 5th, 19.4% of children 5 to 11 years of age have received 1 dose, and 4.8% are fully vaccinated. And individuals ages 18 to 29 have the lowest vaccination status in the county at 61.5%. fully vaccinated. Moving on to the next slide. Finally, as we enter the holiday season and the winter months, it is important to keep in mind that COVID-19 is not the only major respiratory virus that could be prevalent during this time of year. The amount of influenza or flu last year was minimal due to the extensive preventive measures implemented for COVID-19. However, the stay-at-home and mandatory mask orders were lifted, but preventive measures are still strongly recommended. Influenza is expected to circulate more widely this year compared to last year, and given influenza can also lead to hospitalization and death, everyone 6 months of age and older are recommended to receive a flu vaccination each season, especially pregnant women and those individuals with underlying medical conditions. You can get your flu vaccination from your provider or pharmacy, or you can find flu vaccination locations at no cost by going to our county website, San Diego Immunization, to get a listing of the locations of our San Diego immunization clinics. You can also scan the QR code that's shown here on this slide. Now please welcome David Estrella.
Thank you, Dr. Wooten, and good afternoon. In March 2020, the county stood up the Public Health Hotel Program in order to slow the spread of COVID-19 in the community. The purpose being to alleviate strain on the hospital system by providing a place for isolation or quarantine for those who are able to do so independently without a higher level of medical care. The program is made up of 2 components: isolation hotels and high-risk hotels. The isolation hotels provide lodging and services for people who are confirmed or suspected of having COVID-19 and do not have the ability to isolate or quarantine elsewhere. The program serves a variety of populations, including persons experiencing homelessness, first responders, and migrants entering the county seeking asylum. The high-risk hotels provide safe isolation for people who are not infected with COVID-19, however, due to a medical condition, have a higher risk of negative impacts associated with contracting COVID-19 and also experiencing homelessness. In order to quickly stand up the program, the county managed the day-to-day operations of the isolation hotels, while the Regional Task Force on Homelessness managed the high-risk hotel program. Behavioral health services were provided by a county behavioral health provider. Subsequently, a competitive procurement was released to secure a service provider, and the county entered into a contract in July 2020 to manage the day-to-day operations of both program components. Since initiating the program, nearly 13,500 people have received lodging and necessary services at the isolation hotels, and another 207 at the high-risk hotels. The average monthly cost to operate the program is approximately $5.2 million, which currently is reimbursable by FEMA. However, it is unclear how much longer FEMA's reimbursement will continue, with the most recent extension only lasting through April 1, 2020. The public health hotels provide a variety of services free of charge to all guests, including a private hotel room with amenities such as cable TV and Wi-Fi, daily wellness checks from a registered nurse, behavioral health services, necessary over-the-counter medications, meals, laundry service, assistance in securing self-sufficiency resources, and more. In addition, guests at the high-risk hotels receive ongoing housing-related case management to help identify and transition into longer-term housing opportunities. As shown on this slide, occupancy at the public health hotels has steadily declined since the peak in September 2021. At the height of the pandemic, 4 hotels were utilized to provide isolation for up to 930 people on any given night. As vaccination rates have increased and positive cases decreased, so has the need for this critical service. Today, 1 hotel is being used for isolation, and between 100 and 150 guests are served on any given night. In late September, the state established its own isolation hotel, modeled after the county's program, that serves as the primary hotel for facilitating the isolation and quarantine of known or suspected COVID-positive migrants seeking asylum. The high-risk hotels are also seeing a decrease, as guests are linked to permanent housing resources and exiting the program. The Federal Emergency Management Agency, FEMA, announced an extension of eligibility for reimbursement for COVID-19 related to non-congregate shelter through April 1, 2022. It is anticipated that extensions could end after that point. Additionally, contracts with the service provider and behavioral health provider will also end on March 31, 2022. New procurements would be required to continue with either of these services, and the county would need to identify alternative funding sources. These anticipated actions, combined with a decline in need for COVID-positive related public health hotels, necessitates transitioning of this program. The isolation component of this program will naturally ramp down as guests complete their isolation and quarantine period. We will stop accepting new referrals into the program on March 1, 2022, in anticipation of vacating the hotel by March 31, 2022. Once the isolation hotel ceases operations, the standard public health process for addressing infectious disease, isolation, or quarantine needs will be utilized for COVID-19. Currently, throughout the program, the county has provided guests in the high-risk hotels assistance with identifying permanent housing resources, the primary source being HUD's emergency housing vouchers. These vouchers provide permanent rental assistance to persons experiencing homelessness. Nearly 100 guests in the high-risk hotels have been matched by the Regional Task Force on Homelessness to these vouchers and referred to the Housing Authority of the County of San Diego. Other permanent housing resources, including rapid rehousing and reunification with family or other support networks, will continue to be utilized to assist in permanent housing placements. As guests exit the program, connections to ongoing behavioral health services, including substance use services, will be made available. This helps to ensure ongoing success and housing stability for the former guests. Unfortunately, we know that for a variety of reasons, not all guests will exit the program into permanent housing. Collaboration with city partners will be critical to ensure that those who do not identify permanent housing receive appropriate referrals to longer-term shelters. I will now turn the presentation back to Gary Johnston. Thank you.
Thank you, David. In addition to receiving this update, we recommend your board take the following actions with respect to this item. Ratify all actions. taken in response to the local health emergency and local emergency. In accordance with Board Policy A-87, awarded contract with PerkElmer Health Sciences Incorporated for SARS-CoV-2 reagents, consumables, and supplies. In accordance with Board Policy A-87, award a contract with Illumina for 2 MISEC equipment, maintenance, and supplies. Authorize a competitive solicitation for the Beckman Coulter Biomech I-7 equipment for molecular sequencing of COVID-19 samples. Take any other actions necessary to address COVID-19 pandemic emergency response. Subject to your questions, this concludes our presentation.
Thank you. Let's hear from our public speakers on this item.
Thank you, Chair Fletcher. We have 39 requests to speak on this item, 25 in person, 14 by phone. We also received 28 e-comments, 24 of those in opposition. We'll begin with the in-person speakers. Any individuals that requested to speak by phone, please dial into the conference line now using the instructions that were provided to you. I'll be calling you in groups of 5, so as your name is called, please come forward and stand against the east wall under the murals until it is your turn to speak, and you may come forward in any order. I'd like to invite forward the following individuals: Robert Wellstand, Audra, Mike Borrello, Michael Brando, and Sam Plantowski. You'll have 2 minutes to address the board. Again, please state your name for the audio record.
Robert Wellstand. Dr. Wooten, thank you for the update. There are some things in there that I wanted to address. I appreciate that you are publishing death rates now, because I think that's the thing that people want to know about. If you get COVID, how deadly is it? It's not about how many cases there are, because obviously the data shows that both vaccinated and unvaccinated can die from this disease, right? And so I had made a comment earlier, but since you weren't here, I want to repeat that comment, because I would like to call on the county to actually publish hospital survival rates in the COVID Watch report, as this was something that was represented in City Council by Council Member Von Woolpert on November 29th, where she said that there were exactly 0 hospital recoveries among the unvaccinated. I think that's not a fair representation and should be investigated closer. I actually took the opportunity to look at the COVID Watch data from a couple of different samples in time, and one in particular I found interesting was on August 14th, that there were data in there, cumulative data is my understanding, that supports that there's a 3-to-1 ratio of fully vaccinated to unvaccinated in cases. But if you don't look at cases, but look at the rate of survival of hospitalization, I took deaths divided by hospitalization numbers reported in that, I found that it was actually, of the unvaccinated, it was a survival rate of less than 0.8%, but for fully vaccinated, it was about a 33%, sorry, I'm saying this incorrectly, 0.8% death rate, where the death rate was about 33% for the fully vaccinated. And that's a very stark contrast that kind of undoes the emergency of when you get, if it's bad enough to be hospitalized. Thank you.
Next speaker, please.
Audra, this is hilarious. It's great. Yeah, so we're using kids to act like we need to get vaccinated because the kids are spreading it, right? Poor things. Or poor you, because that's super evil to use kids as a ploy to get people to be vaccinated. And I don't know what you're doing, spending $5.2 million a month on hotels for people. And sometimes there's only like 100 people in there, maybe a little bit more. It's 50 grand per person, per day, or month. But regardless, I mean, that's ridiculous, because you won't even show, you talk about the fully vaccinated and the not fully vaccinated. How about you bring in the not vaccinated and then show partially vaccinated, fully vaccinated, and not at all. And then maybe we'll talk numbers, because people are dying from the vaccine. You don't even want to say that. Do you know how many people have died in San Diego from the vaccine? I bet you'll say none. Do you know? How many? 1, 5, 10? I know several. Do you even know? Because you don't care. You care about a faux disease that now you want to bring in this other variant. Well, it hasn't hit us yet. Oh my gosh, well, what if I have it? Should I put on a mask? Should I be afraid? Are you guys afraid if I have Omicron? I don't know. What do you think? Yeah? I mean, because it's funny. It's like you guys just act like you're spewing all this data. Wilma, you can't even get that data yourself. It's funneled down to you from people who have told me COVID doesn't exist.
Thank you. Next speaker, please.
Mike Borello. November 2nd, Aaron Siri, lawyer, gave a deposition before the Senate committee regarding vaccine mandates. Although YouTube censored the session video, Siri's testimony went viral. Nothing can stop what's coming. Siri's clients, many physicians, have suffered vaccine injuries themselves. Their own medical establishments tell them, "We don't believe you." They were told it was psychological and referred them to counseling instead of treating the injuries. They submitted VAERS reports expecting a phone call that never comes. Then contact the CDC, FDA, or public health authorities, but the response is either silence or, "Don't worry, your issue is not an issue because it's not an issue in VAERS." Lastly, Siri asked his physician clients, "Will you make public the failing of our public health agencies?" But no physicians agree to go forward. They fear to do that. Until Dr. Patricia Lee herself, not injured by the vaccine, could no longer sit idly by witnessing the horrible injuries. Dr. Lee, like others, reported her cases to VAERS, but not just any cases. A young woman pregnant became paraplegic, living just long enough to have her baby, and then died. A month later, 2 young women who lost their small intestines. No response from the agencies. After the same rigmarole, Siri's firm wrote the FDA and CDC, "Are you really going to ignore this mainstream pediatrician trained at Harvard and Georgetown Medical Centers who's telling you about serious injuries from this product?" Eventually they met, but nothing happened. Nothing to see. VAERS is a wonderful system, and we're not seeing any safety signals. Everything's fine. As of today, almost 20,000 deaths have been reported in VAERS.
Thank you. Next speaker, please.
Hi, I'm Sam Plantowski. On November 2nd, the British Medical Journal, digital object identifier 10.1136/BMJ.N2635. There was the Pfizer contracted with Ventavia to run its clinical trial, and it says, quote, "A regional director who was employed of the research organization Ventavia Research Group has told the British Medical Journal that the company falsified data, unblinded patients, employed inadequately trained vaccinators, and was slow to follow up on adverse events reported in Pfizer's pivotal phase 3 trial." And this was for the Pfizer-BioNTech vaccine. That regional director tried to fix the issues within the company, no response. They reached higher up at federal level, they were fired later that day. Out of 153 of Pfizer's studies on the vaccine, 9 were audited by the FDA. This wasn't one of those studies. Currently, Ventavia is running 4 more clinical trials, 2 of which are in San Diego County. One of them is, clinical trial number is NCT 050-35212, and the other one is NC2 0495626, and that last one is on the biological BNT 162B2, or a placebo on people aged 16 years or older. So if they run a shoddy trial then, what makes you think they might not do it again? Thank you.
As the next speaker is coming forward, I'd like to invite 5 additional speakers. As your name is called, please come forward and line up on the east wall. Kira Legler, Jeff No Way, Michael Descanio, Sandra Martinez, and Lana Cotton.
My name is Michael. I did not listen to one word any of you said. It's over. It's over. I want to say this is not a threat. This is not a threat at all. There was a young, well, no, it's actually a senior citizen, an elder that wanted to be here today who's never even come to one of these meetings and sent me a message to you. And please know, this is not a threat from me. It's not a threat from this person. Take this in a spiritual context. This is a message from an earth angel. Your time is up. God sees all your wicked ways, and it's time to end it. You're hurting and killing innocent people, especially his children. Now you will see and feel his wrath. You're hurting his children. Now he will hurt your family, your friends, your children, until you stop your wicked ways. May God have mercy on your souls. Now, that's a message for all of us, including me, but it's a warning to all of you in the spirit of, say, the prophets of the Hebrew Scriptures or the book of Revelation, whatever you will. And by the way, there are spies in this building. It's been leaked out by multiple people about there were plans after that August 31st meeting that you had already written up that you were going to lock down San Diego again, force this, and this. And it was because of the outcry of the people that it was forestalled. We're watching you in 2022. God bless you.
Hi, Kara Legler, native San Diegan of 39 years. I'd like to first begin by remembering and thanking our brave veterans that bravely fought 80 years ago today at Pearl Harbor. I find it interesting that Supervisor Fletcher has not mentioned nor recognized this date in our history. Not surprisingly, though, on June 21st of this year, the American Journal of Therapeutics and U.S. National Library of Medicine's National Institutes of Health published an article concluding that, quote, evidence finds that large reduction in COVID-19 deaths are possible using ivermectin. Using ivermectin early may reduce numbers from progressing to severe disease. The apparent safety and low cost suggests that ivermectin is likely to have a significant impact on the SARS-CoV-2 pandemic globally, end quote. So why the continued push for these experimental and poisonous vaccines? Why do you need more money to buy more crap for a disease that we know how to effectively and cheaply cure? We shouldn't even be discussing vaccine injuries, but allow me to enlighten you on the latest VAERS data released by the CDC on December 3rd, showing a total of 927,740 reports of vaccine injuries and adverse events following vaccination between December 14th, 2020 and November 26, 21. This data includes a total of 19,532 reports of death, an increase of 283 over the previous week, and 146,722 reports of serious injuries, including death, during the same time period, which is up 3,325 compared to the prior week. Of these numbers, there have been 2,586 adverse events in 5 to 11-year-olds, 34 as serious, and 2 deaths. 1,581 of these events have occurred just since November 1st of this year.
Thank you. Next speaker, please.
Thanks for your time. My name is Mike Descanio. I'm a 16-year San Diego resident with a biology degree from Rutgers University and over 10 years listening to vaccine safety whistleblowers. First off, what your expert is saying contradicts reality. UCSD currently has a COVID outbreak among fully vaccinated employees, some deathly ill, meaning the vaccine is not effective. Now let's talk about safety. Yes or no, have any of these vaccines been evaluated for carcinogenic potential? What does that even mean? Have they been evaluated to see if they cause cancer? The answer is no. And it's written right there on every single vaccine package in section 13.1, non-clinical toxicology. So you could have the smartest person up here give a presentation on how safe vaccines are, and they don't even know if vaccines cause cancer. How many people in here had their lives affected by someone with cancer? Look at that. Everyone, all of you should raise your hands too, because cancer is a far more deadly pandemic than the flu, which we used to fight with chicken soup. And now look at us, injecting chemicals. The truth is that the truth is not a single one has been evaluated, and it's written right there on the vaccine package. And yet you want to inject these chemicals into all of us, and the makers have zero liability? That's insanity. You want us to put these chemicals into our friends and family? Does he deserve to know if these cause cancer? Does this guard here, does he deserve to know if these cause cancer? We all deserve to know, and it doesn't happen until you guys demand that from the pharmaceutical companies selling you these chemicals. Oh, here's the flu vaccine contains aluminum. Contains formaldehyde and aluminum. Formaldehyde is known to cause leukemia. Guess what the #1 childhood cancer is? And guess what? Look into pet vaccinations, injection site sarcomas.
Thank you. Next speaker, please.
My name is Jeff, and I'm excited that it's finally December. I mean, we all know the stupidity will get cranked up a notch before solstice, and you evil puppets will try some crazy shit as it relates to the latest moronic lie of Omicron or boogeyman or whatever smoke and mirror nonsense you murderous clowns come up with to try to cover for all the vaccine-caused death and illness. What a joke. Variant. Variant equals vaccine injury, period. The reason, sorry, can't hold my glasses on. The reason December is exciting, though, is because as you and your globalist handlers overreact to so many of us around the world saying, shove it to your death vax, your furthered stupidity will result in more of the masses waking out of their slumber. Have you seen the size of the latest protests and rallies around the world? They're enormous. Gives me goosebumps. The marches here aren't that big yet, but that's just because here at, MK Ultra Central, Americans are just a little more saturated by the mind control. That mind spell, however, has been dissolving as of late. Have you noticed, Nathan? I have. It's about to get fun. So hurry up, do whatever unconstitutional BS you have up your tyrannical sleeves, Tara, because I need just a little bit of help waking the rest of the population. And I know that you narcissistic criminals are going to help provide that info. I know it. And I just can't wait for the Nuremberg trials to come. I know you know they're coming, and none of you will skirt accountability. Bring it on, tyrants.
Next speaker, please.
Lana Cotton. I've been extremely concerned about the COVID vaccine since I discovered that they were only in stage 3 and not FDA approved. Since then, I've devoured all the information I could find about these shots. They're not really vaccines, and now I'm even more alarmed. One article I read recently was by Lieutenant Colonel Teresa Long, MD, who was responsible for certifying the health of military pilots in Fort Rucker, Alabama. She has identified, diagnosed, and treated COVID-19 infections following the administration of EUA vaccines. Here are some of her most shocking conclusions. None of the ordered emergency use COVID-19 vaccines can or will provide better immunity than an infection-recovered person. All 3 of the vaccines, Comirnaty is not available, in the age group of her patients are more risky, harmful, and dangerous than having no vaccine. Direct evidence exists and suggests that all persons who have received a COVID-19 vaccine are damaged in their cardiovascular system in an irreparable and irrevocable manner. Due to the spike protein production that is engineered into the user's genome, each recipient of the vaccines already has microclots in their cardiovascular system that present a danger to their health and safety. Such microclots over time will become bigger clots by the very nature of the shape and composition
composition of the spike proteins being produced, and said proteins are found throughout the user's body, including the brain. Dr. Long stated that compulsory COVID mRNA vaccination programs should be immediately suspended until research can be done to determine the true magnitude of risk and immediately implement alternatives for these vaccines to include FDA-approved ivermectin and hydrochloroquine, among others. This insane pressure to take these shots must end. All who continue are committing crimes against humanity. Will San Diego be a leader and say no to this murderous course? At the very least, promote freedom of choice. This is not misinformation.
Thank you. As the next speaker is coming forward, I'd like to invite 5 additional speakers: Robert Cotton, Amber Long, Luke Weingarten, Mark Dorian, and Consuelo.
Hi, I'm Sandra Martinez, and today I come bearing a gift for each of you. It is a handout written by Dr. David Martin called the Fauci COVID-19 Dossier, available online, and it outlines the COVID issues. There are over 4,000 patents which specifically conflict with the entire narrative that there is a novel virus, which there isn't, that there's a novel disease, which there isn't, because it was identified in Wuhan, China in 2013. Shown through the patent records, there is nothing new and nothing novel. Anthony Fauci and the pharma industry's dream was to come up with a universal vaccine platform which they could get the entirety of humanity dependent upon. That was their stated objective in September of 2019, when they said that by September 2020, the world needs to have an experience with the global release of a respiratory pathogen giving rise to a universal vaccine platform. That is what they said would happen in 2019, and by September 2020, they achieved their mission. Fauci funneled millions of taxpayer dollars to China's Bioweapons Defense Lab, the Wuhan Institute of Virology, through EcoHealth Alliance. In 2015, Peter Daszak of EcoHealth Alliance said, to sustain a funding base beyond the crisis, we need to increase the public understanding of the need for medical countermeasures such as a pan-coronavirus vaccine. A key driver is the media, and the economics will follow the hype. We need to use that hype to our advantage. Investors will respond when they see profit. Nowhere does he talk about health. He talks about profit. This is a financial racketeering domestic terrorism campaign. The Fauci dossier will show you without doubt that this campaign of fear and infinite injections is a financial conspiracy designed to harm humanity. Look up the Fauci dossier on DuckDuckGo. Look it up and read it. Thank you for your time.
Next speaker, please. Next speaker, please. You may come forward in any order.
Luke Weingarten. Some people call me Mr. America. I'm just here to tell you guys that I think this is a clown show. Your statistics aren't real. There's no way to determine, the difference between common cold, COVID, and the flu with this PCR test that you're basing all your information on. Joseph Goebbels would be proud. I think that Satan's cheering for you guys. But we the people, we're with God. And God already won. We're just playing out the rest of the game right now. That's all I got.
Good afternoon, Board of Tyrants. My name is Amber Long. I have lost all faith and trust in you guys. I now have faith in myself. I am not here today because it's fun or because I enjoy losing a work day during Christmas time. I am not here because I was made to be or paid to be. I am here because day by day, my conscience screams in my ear. I am here because it is my moral obligation as a human being to protect those around me from tyranny. I am here because I need to be. I am now the founder of North County San Diegans Against Mandates. With that, an MLK Junior Day right around the corner, I will read some of his inspirational quotes we could all use today. Courage is an inner resolution to go forward despite obstacles. Cowardice is submissive surrender to circumstances. Courage breeds creativity. Cowardice represses fear and is mastered by it. Cowardice asks the question, is it safe? Expediency asks the question, is it is it politic? Vanity asks the question, is it popular? But conscience asks the question, is it right? And there comes a time when we must take a position that is neither safe, nor politic, nor popular, but one must take it because it is right. Next quote, never forget that everything Hitler did in Germany was legal. Next quote, I submit that an individual who breaks a law that conscience tells him is unjust and who willingly accepts the penalty of imprisonment in order to arouse the conscience of the community over its injustice is in reality expressing the highest respect for the law. Next quote, we who engage in nonviolent direct action are not the creators of tension. We merely bring to the surface the hidden tensions that is already alive. Next quote, our lives begin to end the day we become silent about things that matter.
Next speaker, please.
Mark Dorian, your Channel 10 news story December 3rd was about how San Ysidro and one of the other areas have near there have the highest vaccination percentage and also the highest rate of new cases, of COVID cases, which is in stark contrast to Wilma Wooten's declaration. There are literally 1 out of 770 people in San Diego County, I did the math about 4 days ago, that have died from COVID. It's not an emergency. Obviously, the vaccine companies and the global agenda would like to promote it as an emergency so it can bypass our rational, logical thinking and send everyone into a fear state. But 1 out of 115 people died before COVID. That was the normal mortality rate in the United States, just dying from something. So 1 out of literally 769.585, to be exact, is not an emergency. Furthermore, Sweden did no lockdowns. LA County and Sweden both have about 10 million people. In fact, Sweden has slightly more. And they have a quarter of the deaths from COVID that LA County has. And their people were working in factories, working in offices together, drinking at bars, having a thriving economy, and going to restaurants with their family and friends the entire time. It's obvious that the vaccines are failing. They're not effective. And, but it's all part of a...
Thank you. Next speaker, please.
Hello, Board. Bob Cotton. Allow me to reintroduce Dr. Mark Sawyer. He was presented as an infectious disease specialist at Rady's Hospital, also a professor of clinical pediatrics at UCSD. He gave a presentation with Wilma Wooten at a recent board meeting and then was featured in 2 videos sponsored by this very board titled Public Health Misinformation Panel. Here is the esteemed doctor in his own words on February 3rd last month.
Wanted to jump in on saying the vaccine doesn't work, so why get it? And it is true that vaccinated people can get infection, but they don't end up in the hospital. So the vaccine is working extremely well to keep people out of the hospital and dying from COVID. So, you know, it's not a perfect vaccine. You can still get infected, but if it keeps you from getting in the hospital, it's doing its job.
Let's listen again.
Of breakthrough, because people are saying the vaccine doesn't work, so why get it? And it is true that vaccinated people can get infection, but they don't end up in the hospital. So the vaccine is working extremely well to keep people out of the hospital and dying from COVID. So, you know, it's not a perfect vaccine. You can still get infected, but if it keeps you from getting in the hospital, it's doing its job.
Keeps you from getting in the hospital. Is any of what he just said the truth? Our own county health department reports hospitalizations and deaths since January 1. Fully vaccinated hospitalizations, how many? 228. Fully vaccinated deaths, 107. Does this Delta data confirm that what this expert says is true?
Thank you. Next speaker, please. As the next speaker is approaching the podium, I'll call 5 additional speakers: Patty Stottlemyre, Nemisha, Jason, Sean Fredrickson, and Bridget Dulcas.
Consuelo, you want authorization for any action? I've got my native ancestors' antennas up for this action. What actions what actions exactly will you be ratifying? I won't waste time speaking on the facts that you all continue to ignore from your constituents, but I will take the time to speak to the people listening from home. It's gonna get bad, like seriously bad. So if you know what is in fact really going on, which is total overreach by government, then it's time to step up and show up. Don't wait on these local organizations who mostly show up for photo ops in the press to further push themselves and for their own personal lucrative gain. You know which ones I'm referring to on the record. Always on, yeah, whatever. It's time for us to really unite for the purpose of medical freedom and justice for all. And let's remember, tyrants are not the problem. People obeying tyrants is the problem. The people have the power and always have.
Patty Stottlemyre. In March of 2020, COVID-19 was declared a public health threat. Over the last year, the real public health threat is not so much COVID-19, but the mandates that have been decreed, i.e. lockdowns, resulting in a mental health crisis of enormity, depression, and now we just heard with item 22, massive increase in drug overdoses, suicide increases. Then there's the Russian roulette injections, resulting in compromised immune systems, resulting in, well, actually probably more susceptibility to the COVID infection. Also heart damage, myocarditis, strokes, neurological damage, long-term disabilities, and death, to name a few. And then there's the nonstop fear-mongering coming from the mainstream media and the public health entities. And now in San Diego, we have a public health threat of government overreach, of outright denial of the First Amendment rights of constituents by ordering arrest for clapping for public testimony.
Speaker, please.
My name's Sean Fredrickson. It's a pleasure to be here. Nathan Fletcher, how offensive is this to you? Standing ovation. It'll get you thrown out of this building. Why? Because when you give a tyrant, one tyrant, the authority with two people who don't question that tyrant, you're going to run into a problem. What happened with Hitler? What happened with Stalin? What happened with Mussolini? We've learned from history, haven't we, Fletcher? We've learned that bad men who are not moral will take an opportunity and run with it, naturally, because that's what they do. So here's the beautiful thing. I am here as a free man in a clown world, because outside these walls, COVID doesn't exist. This is a beautiful thing, because inside these walls, I see more masks on people, typically the ones that are sitting up here, and only on those that are sitting back there that work for you to promote your ideas. So what's interesting about this is that you claim to be one of the representatives for the people, but in reality, you're chasing money through corporations and unions. Wilma, how much have you talked about ivermectin, hydroxychloroquine, other things that would empower people? Fletcher, when do you talk about morality and truth? You don't. You couldn't possibly, because you don't comprehend the value of morality and truth. You value dependence. You value people to be weak so you can move them around and guide them into old folks' homes. Desmond, or this idea of homelessness, Fletcher, or this concept of drug rehabs, because they're all dependent on the system. It's time to wake up. It's time to realize that we, the people, if we want freedom, we need morality and truth. We need individual responsibility. And so what I'm calling you guys to show up is January 8. January 8, right here at the County Board of Supervisors, we're going to have a big event to promote individual freedom in 2022. 2020 and 2021 are gone. We're done with the fear-mongering. We're done with Fletcher. Reamer's going to get recalled. It's going to be a great year in 2022. Let's go.
Thank you. Next speaker, please.
Nimisha. So family friend passed away at the age of 36, 2 days after taking the second dose of the Pfizer vaccine. He had a heart expansion and then subsequently died of a heart attack. Perfectly healthy person. This is not the story of just my life. There are other people. There are soccer fields in England where people are dying in the audience and soccer players are dying on the field. Japan is researching this vaccine and its side effects in young people because they've woken up. The Japanese are going to do this, and they're going to get to the bottom of it. But let me tell you the long-term effect, because we're all about planning and looking at the long-term trends. We're going to have a bunch of very sick people and sick doctors and nurses taking care of very sick people. The people who showed up at the hospital who died of COVID, who are the unvaccinated who died of COVID, they died because they were administered remdesivir, and they're whistleblowers who are speaking as of today, they're speaking about how remdesivir is killing people. That's going to be coming out very quickly. This vax is a covert operation. It's a mass psychosis in people that's leading them to think that something is wrong with them, and it's creating other issues in them, as well as the adverse effects of the vaccine. I'm just not sure if you're really serving the community or you're serving other nefarious forces. I'm questioning that. So I ask you to please make the right choices. The people in San Diego are extremely reliable people, but the long-term trend looks like monies are going to dry up, the stock market is going to go down, people are going to be on the streets, and it's not looking good. People need to have their individual rights given to them, and...
Thank you. Next speaker, please.
Bridget, let's end this emergency. I don't want a lot for Christmas, just body autonomy. I don't care about the variants because of natural immunity. I just want my freedom now. The Constitution will show us how. Make my dreams come true. And the state of emergency and acknowledge early treatment. Ivermectin, not just horse paste, and hydroxychloroquine, vitamin C and vitamin D, then the zinc and quercetin. I won't wear a useless mask. I don't need to stay at home, and my kids should go to school. We don't need to be alone. I just want my freedom now. The Constitution will show us how. Make my dreams come true. Baby, I end the emergency. Let's have a happy holiday, everybody.
Before the next speaker begins, I'll call the remaining speakers in opposition to this item: Mimi Crandall, Corbin Sabol, Joseph Weber, and Cindy Paris.
I'm Jason Robo. We've gone over this before about cortisol and inactivity and trauma, making people more susceptible to sickness. 94% CDC says have pre-existing conditions. Dr. Nowak was just murdered. He did a presentation as a doctoral thesis on graphene hydroxide as micro razor blades. They're in the vaccines. Omicron is an anagram for moronic, so that's a fun fact. We showed you guys pandemic indoctrination. Obviously, you're pro-medical tyranny. This is an inside jab. You want to invade our immune systems. You might as well make brooms illegal so we could sell more vacuums. Yeah, this is a war, and war is confusion. That's the etymology. Speaking of confusion, lies, I was in the Young Turks. Dr. Rashad Ritchie said that I was at the city council. I'm a Trumper, and my radio show is canceled. That's not true. Newsweek also said that. His show is called Indisputable. Apparently not. Ken Stone, Times of San Diego, also lies, his headlines. I just watched the film They're Trying to Kill Us. If people actually care about people of color, you would watch it. It talks about how food deserts are basically a modern-day eugenics. And the sentiments I had for Mr. Wooten were for the dishonor of the legacy of Tuskegee with these policies enforcing mandates. I don't think it's racism to criticize a person of color dishonoring that legacy. It is a new form of segregation I would call vaxism. I have a video about it on my YouTube. You care more about the CARES Act money. You are morally and financially bankrupt, and that's why your policies are fraudulent as we come week in, week after to reveal that. And yeah, so this is hypocrisy and is traitorous. And I would say it's in closing, this is strong language, but you are creating the new segregation, and the unvaxxed are going to be the new niggers.
Hello, board. I'm Mimi Crandall. I'm a nurse of over 30 years. Last time I was here, there were several million views on social media. Let's see what happens today. I'm bringing some thoughts from several thinkers. Carl Jung once said, "It is not famine, not earthquakes, not microbes, not cancer, but man himself who is man's greatest danger to man, for the simple reason that there is no adequate protection against psychic epidemics, which are infinitely more devastating than the worst of natural causes." Dr. Joseph Mercala, a mass psychosis is an epidemic of madness that occurs when a large portion of society loses touch with reality and descends into delusions. The results are always devastating. Cognitive dissonance, Frantz Fanon said, "This occurs when people hold a belief that is very strong, and even when challenged with evidence or proof that is irrefutable, they are unable to accept it. Hence the following. The protected need to be protected from the unprotected by forcing the unprotected to use the protection that didn't protect the protected in the first place." Thank you.
Next speaker, please.
Hello, my name is Cindy Paris. Good afternoon. Over the last 6 months, I've been attending these meetings, and it's definitely been educational. I've seen the complete and utter disregard for the will of the people, the complete and utter disregard for science that opposes the government's narrative, the purposeful silencing of anyone who dissents. You on this board are complicit as long as you continue to vote for this. Because of the fraudulent continuation of a local emergency that, as Mr. Cox, who was the chair, said they were going to vote for it even though the emergency did not exist. So it's been 2 years. The emergency still does not exist. We who live in the real world know the truth. This is about power and an agenda to change our country. As Japan woke the sleeping tiger on this day 80 years ago, you, over the last 2 years, have woken the sleeping tigers in California. You think that we out here are the minority, but we are not. We are the majority. This, by all appearances, was planned, and you are continuing to plan for a local emergency through 2023, and you are supposed to think that it's an emergency. We're just going to keep indefinitely doing this, Jim and Joel, who's not even here. Thanks. You guys are on the losing side. There are court cases that are being decided in Louisiana and Missouri that are going to affect you. You are taking her, who is an unelected official, not answerable to the people's, her recommendations and imposing them on us. And that is exactly what the Louisiana court said you could not do. These are going to be overturned. You need to understand that we are not going to stand for this. I want the people that are listening to me online and here in this room to remember that medicine is a practice.
Thank you.
It's
Next
a practice.
Speaker, thank you. Next speaker, please.
Good morning, Joseph Weber. There's so many facts that have already been given you. I'm not even going to waste my time on that because we've been doing this for 20 months, haven't we, Wilma? And you're not listening. But you know, in 2020, February, you declared a pandemic, which is illegal. I already told you that. But you had 7 days to produce the material evidence that the SARS-CoV virus actually existed to show us that there was an extreme peril, because Government Code 855 gives 4 parameters that have to be passed to declare a local emergency. You have never produced that material evidence, even though Mr. Jim Desmond, I was at the meetings that he demanded you give him the evidence that this is really a local emergency. And then I waited till the next meetings and you still did not do that. You keep talking about cases. 0.03% of cases in San Diego County, rounded up, is 0% people dying from this COVID case. You have none that you approved, and yet you keep going with this. Oh, by the way, there's a free chipping program that you guys created someplace down the line and funded. Well, I think you funded it, but I just got a letter 2 weeks ago, and you know what they told me, Michael? They told me that the program wasn't funded enough, and would I please donate more of my money, an additional tax, so that we could do this program for other people. Maybe if you took 5.2 million for 1 month, just stop it in February instead of March, take that 5.2, put it in the free chipping program, and oh my goodness, you'll stop fires in our rural areas. 5.2 million will do it. Why don't we think about that? Where are we going with all this? You keep spending money on things that do not affect her stats. They don't change it at all, even though you had free hotels for the homeless and illegal aliens. And guess what? Why don't we just change it, the name to the homeless?
Next speaker, please. Thank you. Next speaker, please.
Next speaker.
Hello, Corbin Sable. I am here to voice my strongest condemnation and opposition against Agenda Item 23. You guys need to spend less of our money, not more, less, okay? It's not rocket science. You're spending a lot of our money. I want to hone in on one word that was brought up during one of the earlier presentations, and that was revenue. I think it was Agenda Item 26 for that presentation. The word revenue was brought up. How much revenue does government generate? Let's look at the definition from Investopedia on what revenue is. Revenue is the money generated from normal business operations, calculated as the average sales price times the number of units sold. Does that definition sound like how you collect your money? No, the term revenue does not apply to you. So I'll ask you to never use the term revenue again when it comes to how you collect money, our money. Instead, you can say you steal it without our consent. You can say you're thieves. That's how you collect our money. And then you spend it without our consent on whatever you want to spend it on. Who's getting rich after you pass Agenda Item 23? Who's profiting it? How many kickbacks are you getting, guys? Are we ever going to know? Follow the money. I guess we'll have to do our homework. So what started with 15 days to slow the spread quickly turned into shut your business down or else you'll be punished. Then that turned into get a vaccine or else you'll lose your job. And now we're arresting people because they're clapping? Wow, really? What's going to come next, guys? So let's just say that I treated you guys like you treat us. Like, let's just say I treat my wife the same way you guys treat us. I would say I would be an abusive husband. So how are you guys not abusive to the people? You shut our businesses down. You force vaccines on us. You arrest us for clapping.
Thank you.
Thank you, sir. Your time has expired. Next speaker, please.
We'll now hear from those that requested to speak by phone. When it is your turn to speak, you'll be unmuted and you'll hear a recording that will tell you to begin your comments after the beep. I'll remind the callers that they should mute their TV or live video stream before they begin speaking. We'll begin with our first caller.
Hello, my name is Christina, and I have good news to share. Today, on December 7th, a federal judge issued an injunction temporarily halting the COVID vaccine mandate for federal contractors. So with these kind of developments and other information and requests that we have made in the past, please stop the COVID vaccine mandates and vaccine discrimination. Support the right of your current and prospective employees to make their own individual health decisions, respect bodily autonomy and human rights. If you do not have the right to your own body, what rights do you have? These people have been injured and died from the COVID vaccines. You can go to the website nomoresilence.world and see the testimonials that were taken at Washington, D.C. The COVID vaccines are not like your traditional vaccines. According to the WHO, they agree that the COVID virus is no more dangerous than the common flu. We also know that the PCR tests give false positives for the COVID. So as the PCR test is the only basis for this false state of emergency, there is no emergency. The inventor of the PCR test, his name is Dr. Kerry Mullis. Again, that's Dr. Kerry Mullis. And he called Dr. Fauci a liar. He didn't like Dr. Fauci very much. The way that we do death certificates was modified by the CDC on March 24th, 2020, and it's skewing the data. Instead of actual reasons for death being the actual reasons for death, if the deceased person had a positive PCR test, then they are listed as a COVID death rather than their actual reason for death. Then, again, we know that the PCR tests give false positives for COVID, so then you have this accumulating, misleading information, and also hospitals get more money if they have a COVID death. So this is fraud upon the people. It's being called a PCR test pandemic. Look up Dr. Malone as well. He's a good person to look to. And as stated by the CDC, the COVID vaccine has...
Thank you. We'll now hear from the next caller.
Hello, this is Catherine Rhodes. And first I'm going to ask if you could put your presentation online. And then one thing I didn't like is on the agenda item, it didn't state that you were going to talk about the high-risk Project Roomkey hotel rooms. Because if it was on the agenda, more homeless advocates would be able to give you comments to tell you to actually expand it, not let it go. And for your staff to say it's naturally decreasing, it's not naturally decreasing. It's specifically decreasing because staff is lowering the number of hotel rooms that are available. And also one thing that's very strange, the numbers that staff gave you of 207 people in these high-risk hotels, that's a lot different from the state numbers of 358. So, 207 to 358, why are the numbers different? I don't know. And of course, you can't say that the federal government is going to keep these hotel rooms until COVID is over. Who knows? Maybe it's going to be going on for another year, and you're going to take staff. Staff told you a long time ago that it was going to the hotel rooms were going to close about a year ago. They never closed. They keep on going on, and for you not to take this money, it's just not acceptable. People are dying out there, and you could actually save them by tripling the amount of Project Roomkey. And what they're doing is one time when anybody exits the program, they're not letting anybody else in. So they're doing it. This is not natural at all. You could help so many more people. And then again, the amount of people that you have still in the Project Roomkey whenever it happens to end, you get that amount of free FEMA trailers for them. So why wouldn't you want to maximize the amount of people that are in there? And again, the city of San Diego is helping to do nothing.
Thank you.
You're on your own.
We'll now hear from the next caller.
I'm Richard Golden. We cannot use a vaccine-only strategy. That has failed and will continue to fail. We need all suppress, contain, and eliminate COVID programs to prevent a disaster and super overrunning our healthcare system. These programs are inexpensive, effective, and do not affect businesses in any way. In fact, they help businesses by eliminating COVID and helping the economy. COVID is airborne. We need mandatory indoor air quality requirements for ventilation and filtration. We also need indoor mask mandates with free N95 quality masks given out at county rapid testing pods. We need to educate businesses with entrance metering guideline recommendations to protect the workers and the customers. Expand the temporary lodging program for better quarantines. We need to expand the sewage surveillance program and combine it with PCR or rapid surveillance testing. We need opt-in guidelines for county-controlled contact tracing Excel spreadsheet logbooks for large restaurants and other high risk of spread activities. We need 2 million county-controlled rapid tests for the next 6 months, and we need to set up 10 pods throughout the county. These are being misused by people of privilege and are not available. County-controlled also ensures QA, immediate contact tracing, and preventing false negatives by properly timing the testing. We should not have to go through insurance companies for reimbursements. Please implement as many of these suppress and eliminate COVID programs, including some that are not mentioned. We can end this within a few months. Thank you to our healthcare workers and essential frontline workers. Thank you.
Thank you. Now hear from the next caller.
Hi, Cynthia Antonides. Can you hear me?
Yes, we can hear you.
Hi. Hey, guys, I'm sure you guys are, you probably don't enjoy this all the time, and we keep coming and saying the same thing, and it's obvious that we're not going to change your mind. And, I'm mainly talking to the three of you that vote the majority. So, it's unfortunate, but here we are. I literally ask myself daily if people in general are, accidentally deluded or are they purposely evil? Because at this point, I can't believe how many people are in everyone's business about what they do with their health. I mean, again, what happened to my body, my choice? You guys did a proclamation celebrating abortion in San Diego. So, I mean, that right there, you don't care. There's not a real hardcore respect for human life, okay? So when the people fear government, there is tyranny. When government fears the people, there is liberty. Your first priority, it's not about public safety. You guys keep saying that, but it's not. It's to honor the oath you took to uphold the Constitution, which secures our rights, okay? I have a good friend whose dad had to go to the hospital. She couldn't go visit him because she was not vaccinated. So I don't know if that brings joy to your guys' hearts. I think that's from the pit of hell. And I don't know if you're waiting and you're just maybe salivating at the mouth going, we can't wait to become another Australia or Germany. What's happening with these people? Tens of thousands of people around the world have died from this stupid, useless jab. You need to make a decision about what side that you're standing on. I don't, again, all this love, tolerance, diversity, racial justice, and now you're behind medical segregation. Yeah, it's the variant's called moronic for a reason. And I really hope you guys wake up, because I can't handle seeing kids in masks and hearing people die alone. It's got to be, it's flat out evil. Like I said, I don't want to say you're purposely evil. I don't want to talk that way to you, but I don't know at which point, again, it's really on us, you guys. No one should have ever complied, ever. I don't care if there's a zombie apocalypse out there. There's no government entities that have the right to tell you how to live your life. That's all I gotta say.
Thank you. Now hear from the next caller.
Paul Hinton. Good afternoon, San Diego. Holidays are here. Time to count our blessings. The first known person who got COVID, the Omicron variant in the United States, described it as, quote, a stay home, get a blanket, and watch a movie kind of thing, unquote. That is, it may already be here, unrecognized, some people are actually asymptomatic. We do not have lockdowns and mandates for every new kind of flu or cold. My question to you, Nathan and Wilma, when will the mandates in this county end? And I'll take my answer on the air. Thank you.
Now hear from the next caller.
Hi, Naomi, District 1. I want to just start by honoring the December 7 heroes that actually woke up the sleeping giant. And, so anyway, just commenting on a few things. Hearing by the callers from before, everyone's like, oh, let's go ahead and push these N95 masks. Like if they're saying, hey, put a diaper on every day, like just in case you will poop or something, like for real. Calm down. Like it's not your business. It's not your business to know if we're vaccinated or not. I mean, I'm telling you this because I have healed somebody that had cancer, and now you guys are segregating the people that don't want to get vaccinated and pushing them to the side and say, oh, well, we're not going to honor your transplant because you didn't get vaccinated. You guys are segregating and pushing this agenda. You're done, Nathan, and you're done too, Tara. And you are next, Nora, because you don't ever question anything that he says. And it's Nathan Fletcher is so evil, and you don't question anything. You're just like, it's fine. Go ahead and violate all the people's rights. It's cool, but it's not. I mean, it's poison. And there is a death that, honestly, it really stirred me up when the girl sat up there and talked about the Christmas thing, because honestly, today I was so sad. There was somebody that I did know named Raymond Whitney, and he died from the vaccine. It's some people that we've known locally here, and that is like really sad. And you guys don't do that. You guys don't throw names out there that you guys know because it's not convenient for you. And you guys, the county of San Diego loves to kidnap people. They love to go into hospitals and tell parents that they're going to kidnap their kids if they don't comply with them. And obviously, like, you got to tell them, you know, your rights, but you guys still don't care. But I have so much information. You guys, Dr. Wills.
Thank you. Now hear from our next caller.
My name is Amy Reichert. I'm with Reopen San Diego. Agenda item 22 that you heard previously is proof that lockdowns kill. COVID didn't kill the teenagers who turned to drugs when you locked them down, took away their sports, told them if they hugged grandma that they would kill her. Right now, with the continued state of emergency and the continued public health emergency, the only thing that you're continuing is a state of fear. The fact of the matter is, your own experts either lied or what they said did not come true. They said, if you get the vaccine, you won't go to the hospital and you won't die. The county even trotted out false stats using data from before when the vaccines were even available, saying that if you weren't vaccinated, you had a 98% chance of going to the hospital or dying. What happened to those stats with the percentages? You don't talk about percentages anymore, and I want to know why that is. We want you to know that it's over. It's over, and we will not accept a return to the indoor mask mandate. We will not accept lockdowns, and we will not accept forced vaccinations of our children. Please go to reopensd.org for more information.
Thank you. And I'll hear from the final caller.
Mary here. I again publicly call on Dr. Wooten to drill down the data for the unvaccinated, breaking it down further between the COVID recovered and the never had COVID. I know that many of you are holding tight to the tenet of vaccines as the end-all solution to the epidemic, but other highly respected organizations are starting to pull away from that tactic. For public record, I wanted everyone to be aware that even in light of the new Omicron variant, the two highly respected medical institutions, Advent Healthcare and the Cleveland Clinic, are no longer requiring their employees to be vaccinated. I now ask the San Diego County Board of Supervisors to follow that lead and also move to rescind the mandatory vaccination for county new hires. It is time to declare this disease as endemic, something we simply live with like influenza. This, quote, emergency has been going strong now for 22 months, ever since you declared, quote, just 7 days for emergency powers way back in February 14th of 2020. Much like a perpetual motion optical illusion where a figure appears to be never-endingly climbing a set of stairs, the pandemic response is the political gift that keeps on giving, as long as you can keep convincing people that it is, quote, an emergency. However, numbers are waning, and that illusion is proving ever harder to keep up. In closing, I was going to thank you for keeping these meetings open, but your Lucy in the football stunt on the last item in taking it first, knowing that it would likely invoke strong reactions, and then using those reactions to then issue threats about closing future meetings to in-person attendance, it almost seems like you were trying to set the stage for closing the meetings again. You will find that most people treat you respectfully when you do the same for us. If you knew ahead of time that there was going to be a schedule change, you should have announced it as soon as you learned of it, instead of waiting to spring at the last minute and then feigning indignation at the not unexpected reaction. Shame on you for that stunt today. Thank you.
Thank you, and that concludes public comment on this item. Chair Fletcher.
All right, let me make a motion to approve the items in Agenda 23. Is there a second? All right, we have a motion by myself, second by Vice Chair Vargas. Let's go to Supervisor Desmond.
Well, thank you, Mr. Chair. Appreciate it, and appreciate the presentations from all the staff members here with the updates on COVID. I'd like to address two topics, basically the monoclonal treatments and antibody testing. First, I'd like to discuss the potential of providing more monoclonal treatment centers in San Diego County. I'd also like to increase the public knowledge and awareness of the availability of monoclonal treatment to actually help. Hey.
He doesn't need any help. He's going to do totally fine making his points and asking his questions without any assistance from members of the audience. So please stop disrupting Supervisor Desmond. Please continue.
Okay, so I'd like to increase the public knowledge of the available monoclonal treatment and to reduce the number of hospitalizations and severe reactions to COVID and its variants. I know the monoclonal antibodies, the monoclonal antibody centers are a function of the state of California. However, I'd like to ask staff to work with the state to see if we can place more monoclonal treatment centers throughout San Diego County. My understanding is we have 4 monoclonal antibody regional centers, one in Vista that's only open 4 days a week, Claremont 6 days a week, Hillcrest and Chula Vista 5 days a week, and some medical providers. But I think the public really doesn't know enough about that we have this monoclonal treatment. We have it available. It still can be useful in the early stages of COVID symptoms. And I think we need to make a stronger effort to let people know that's there. That would be another avenue that we could pursue to keep people out of the hospitals. I think so I'd like to make a motion to add to the COVID item to come back with ask county staff to come back with a plan to provide more monoclonal treatment centers countywide. And then secondly, as a species, I think we should be pushing more for natural immunity instead of vaccine after booster and booster vaccine. So, I want to discuss natural immunity and antibody testing to collect data and explore every avenue for success, to give people, more of an idea of, where they are health-wise and helping them make decisions for dealing with COVID. So there were several peer-reviewed studies that were conducted in the early parts of the pandemic. And these studies found that the people that had been infected during the early waves of COVID were about 80% less likely to test positive in subsequent surges. So these studies spanned healthcare workers in the UK, the Danish population, patients in the US at the Cleveland Clinic. And even at, I think the previous COVID meeting, I'd asked Dr. Wooten, about the antibody and the antibody testing in the previous COVID meeting, and I'm paraphrasing here, that you said we have a good idea that natural immunity provides some level of protection, but we're not really sure how much or for how long. I'm paraphrasing. I think that was basically what you said. So we do know the vaccine's effectiveness fades, and that boosters are recommended. I think it's every 6 months so you get a booster. And so Germany and other countries are pursuing antibody testing to determine if people have recovered from COVID with antibodies and have established immunity. But we don't really know how long that lasts. So if people previously tested positive for COVID in San Diego County, we know the date. We know when that happened. We know when that occurred and when they tested positive. We could have our own database if we did our own antibody testing and offered antibody testing in San Diego County, so we know when they had COVID, we know if they still have antibodies or not if we did antibody testing. For persons in San Diego County, we could create our own database, and we could offer this information to the CDC or other entities that are out there. But people may be able to make a more informed health decisions knowing if or not they have the antibodies. And perhaps with this data, those who can't get vaccinated for whatever reasons, maybe religious reasons or something, medical reasons, they might be able to keep their jobs if they could show proof of antibodies. They have to show proof of vaccination, why not be able to show proof of antibodies? So people may find out also that they don't have the antibodies. A lot of people swear up and down that they had COVID, but if they don't have the antibodies, well, maybe they'd be more inclined to take the vaccine or get a booster. So I'd also like to make an additional motion to add to the regular motion, to add this part that I'd like the county staff to look into the feasibility of providing free antibody testing for all San Diego County residents and collecting data on how long the antibodies last with that data and that information and collecting that data about natural immunity. So I guess the maker of the motion.
Yeah, let me go to our medical staff and just hear your thoughts or general thoughts. One on monoclonal treatment, and then the second is the notion of antibody testing and natural immunity.
Yes, thank you, Supervisor, for raising the issue of monoclonal antibodies. I think it's a really important thing. This is another opportunity for us to get the word out. We've been doing it both with the medical community and with the public through many venues, news stories, sector calls, medical detailing, health alerts. This is another opportunity to basically say that if an individual has a positive COVID test, that is either a PCR or an antigen test with mild to moderate symptoms, they're greater than or equal to 12 years old and more than 40 kilograms, which I think is 88 pounds, and there's somebody at risk for deterioration to severe disease, they qualify for these antibodies, which are available both at the 4 monoclonal antibody regional centers you mentioned and through the local healthcare systems. I would ask people to try their healthcare system first because it is available and increasingly so at really all the major health systems. But if they can't get through, either they or their doctor can directly call the following phone number, 619-685-2500, and they will get a person, or they can leave a message and we'll get a call back rapidly to go ahead and schedule antibody treatment if they qualify at one of these centers. As you mentioned, this is a limited resource that the federal government is distributing to the states, who then distribute it to the counties. Up until a week ago, we have actually had a pretty good match between supply and demand coming into the county. I think last week was the first week that we actually could not fulfill all of the requests coming from the local systems to get the allocation that we wanted to get from the state, and so we have to watch that very carefully. We want demand to go up because we want the right people to get the treatment, but we work actually already very closely with the state to maximize the number of treatments that we get and to go ahead and set up different locations. And I want to give a shout out to the City of Chula Vista, the City of San Diego, Family Health Centers of San Diego, Vista Community Clinic, Neighborhood Health, San Isidro, and these are all the organizations that have been involved with creating these regional centers, which frankly are a national model. We had it before other states did. We've been promoting it. In fact, people have come to us to ask how we've done it. And so we're very proud of working with the state to have this capability for local.
I guess my only pushback would be, we know it, the people in the system know it, and everybody else knows it, but I don't think most of the population of San Diego County knows that that's available, it's free, and if they meet certain qualifications. I've put the number out and everything else. I couldn't tell you what that number is myself, and I'm part of the system. So I just would like to see more emphasis on letting people know. And be honest with you, I know we don't want to not serve people, but if we've got more of a demand and we've got a reason to go to the state and say, we need more because we got this much more of a demand, I think I'd rather have that problem as opposed to the other. So I would just ask for a bigger push for getting monoclonal, letting people know that it's available and it's out there. We may not have the supplies, but I'd rather, that's really what I'm looking for, is a bigger push for the general public to know that it's out there and available.
Absolutely, sir. And the really just quick thing I could say is to make it very easy, if you have a positive test, call 211 San Diego. They'll hook you up. And if you don't have a healthcare provider, they'll hook you up with that too.
Okay.
Dr. McDonald, do we notify people when they get notified that they're positive? Is there a notification process that if they start experiencing symptoms, this may be an option for them?
Again, it depends on where they got the test, but if they got the test through the county system, then we are doing that notification, and all of our contact tracers, when they actually talk with the individuals who are positive, actually mention this as something that's available to them. So yes, we're attacking it from
So it may not be as widely available, but if you have a positive test, at least through us, we're telling you about this option and how to access it. Okay. Can you talk a little bit about antibody testing and the issues of natural immunity?
Yes, Supervisor. Dr. Wooten here. Thank you, Supervisor Desmond, for bringing this issue up again. In our backyard, we have a researcher at UCSD and the La Jolla Institute of Immunology, Dr. Shane Crody, who has been working on this with colleagues both locally, and others are working on this issue across the nation. So this is a very important issue, but it's not as easy as just measuring the antibodies. When we look at the immune system for determining if being infected confers natural immunity, we not only have to look at the antibodies, we have to look at the B cells that produce the antibodies, as well as CD4 helper T cells that causes the B cells to produce antibodies, as well as the CD8 T cells that kills the cells that have viruses in them. So all of those factors, the researchers are looking at in individuals over time after they've become infected, and to look at whether or not those factors are decreasing or increasing, and that helps us to answer the question. The researchers tell us now that it will take years, maybe up to even a decade to answer this question. So it's a very complex question. With a very complex answer, and the researchers are working on this as we speak to address this issue.
But if I guess my thought is, if we could test people, or if people were willing to be tested, and then maybe they test now, and then maybe in 2 months from now, we could take data and find out if it's increasing or decreasing. You know, if it's decreasing over the extra period of time from the first time. I mean, to me, if people know they have the antibodies, they're going to make better decisions, I think, for their health. And so I'd like to get that information. And everybody I've talked to says, I want to know if I got the antibodies or not. And I've heard of it's hard to get the test. It's not local. It's not as free as getting the test for the virus itself. But if people had the knowledge of the antibodies, if they have the antibodies or not, and then we could, you know, like I said, we're requiring vaccinations for employment. If we could provide a different avenue of, okay, I got the antibodies, and so the antibodies are, I don't know if that's just as good or better than a vaccine. If we could get that information out, if we could make that test free and available, just like we do for the test for the virus itself.
Well, that test is at one point in time. It doesn't tell you what your titer, if you get a titer or look at the antibody titer, it doesn't tell you what you're going to look like in 2 months, in 6 months, and even in a year. It's a one point in time. So that's why the researchers are looking at individuals, and UCSD, Dr. Crotty has actually conducted the largest research of 200 individuals following them and looking at all of those factors that I described. Again, it's not just the antibodies. And that information may not be useful to tell you what is your long-term immunologic status going to be in terms of protection or immunity against COVID?
Well, and that's pretty much sounds like the vaccine itself, because we don't really know how long it lasts. And we don't really know the effects of it because we haven't had it for that long, yet we're pushing the vaccine, when really it's still kind of in an experimental phase, although it does keep people out of the hospital. I'll grant that. But I think it would be, I would like to see us pursuing, and maybe come back with more in-depth,
absolutely,
more in-depth knowledge of the, you know, I don't know if it costs $1,000 per person to do that or not. But I think it would help people, I think, make those types of decisions if they know they have the antibodies or not. And because natural immunity should be where we're trying to go.
And researchers are, and we would be happy to invite Dr. Crody here to talk more about that and to come back with a proposal for you as you request.
So I guess I would like to have that as part of the motion.
Dr. McDonald?
I was going to make just a quick comment that actually what we need more importantly than more antibody tests is actually more ubiquitous COVID testing, either PCR or antigen testing that's less cost and more freely available. That, I think, would actually allow people to make day-to-day individual decisions. And again, we as a country are trying to increase our capacity for that. The bottom line with the antibody tests is that, you know, interpreting what they mean over the long haul is still a matter of debate, even among physicians. And so giving that information to patients may be useful just in the extremely short run, but in the long run, nobody really can tell them what that means. And so we really do need these studies to be conducted. And there are national studies going on. There are even studies today of San Diego residents who are being picked at random and being asked to mail in samples to find out what the current prevalence is of antibodies in the community.
Well, could we expand that program to just have regular, I know there's a sample of 200 so far, as you mentioned, in San Diego County. What if we got the whole population be willing to weigh in, or if there be, especially those that have already tested positive, and come and get that information? I think
it is a cost and capacity issue, to be honest.
Well, we're spending a lot of money on hotel rooms.
So why don't we do this, Supervisor? So why don't we take the recommendations we have, add a seventh to continue to work aggressively to provide monoclonal treatment to the greatest extent possible. I think we all agree on that. I think 8 is to come back with some options around the feasibility of increasing testing.
Antibody testing.
Around, let me finish. Both PCR, antigen, and exploring antibody testing. So bring us some options about what we may do around just general increasing of testing, all different types. And then the 9th would be, I think it would be good at our next COVID update to get a presentation on what we know around natural immunity, vaccine plus natural immunity, but have a researcher come in and share kind of what the latest is. And so,
but I would like to see, you know, a potential program put, you know, what it would cost.
Part of the feasibility testing.
Well, and a feasibility of what it would cost. What are we going to gain out of it? I think it'd be good for the county to know itself, you know, where we stand antibody-wise, and it would help, I think, in the analysis. It could help, you know, instead of just UCSD doing it, we could also be part of that, maybe bring the entire population in it. I'm willing to do that.
And I think in addition to that, I think that there's potentially some value in more increase of rapid tests being more readily available as a mechanism to trigger. If you get a test, maybe then you do a PCR. So I just think a look at some options around increased testing in all the categories, both as Supervisor Desmond mentioned along with Dr. McDonald, some of the things that you outlined and mentioned.
Okay, so
Happy to be my... ask the seconder.
Okay, so I have to ask for one more thing, if we could bifurcate item 2.
Bifurcate what?
Or bring vote separately on item 2 for the local emergency.
I don't know, we'll see how we're doing. But you got your amendments in there. Supervisor Lawson-Remer?
Yes. So first of all, thank you for the ongoing diligence and hard work. Just a couple items. So first is on booster shots. I've been getting lots of inquiries from constituents on how and where do they get boosters, and I think it would just be helpful if you could provide maybe a briefer, like a one-pager that we could share with our constituents, and maybe county communications could also get that out. It's just a widespread question. I know that most of those boosters we're hoping people access through their health insurance and their health providers, and then that we're playing a role kind of to backfill anyone who doesn't have access to their boosters through insurance. But frankly, lots of people are expecting that they're going to get boosters in the same way that they got their original shots, which was us as the county being sort of very front and center, providing those, and have been asking me, well, where's the center being stood up? And so I think there's just a need to just make sure folks understand where and how they get boosters in terms of accessing insurance, and then where and how do they access boosters from county sites if their own health insurance is not an option. So I don't know if a motion would be necessary or an amendment to the motion to order to ask you all to put that together, but does that feel like something pretty doable? Yes. Fantastic. I think people would very much appreciate it. I know my constituents would very much appreciate it. Maybe we can get that out through county communications as well and on the website and everything. So that was my big concern on boosters. And then the second thing, I just wanted to take a moment to focus on some of our regions that still haven't gotten even shots 1 and 2, much less boosters. So some of our areas that are lagging behind in vaccination rates. Took a careful look at the data the last couple weeks, and I think it's pretty clear that Vista, San Marcos, and Escondido in particular are lagging pretty far behind. So I just wanted to take a moment to see if we could, I could better understand what your plans are to really narrowly focus and target on these harder to reach populations.
Supervisor, we have our Chief Nursing Officer, Dr. Denise Foster, who's been leading this very effort. So I'll ask her to come up and just speak to that issue.
Good afternoon. Thank you for the question, Supervisor. The County of San Diego has been working collaboratively with a number of community-based organizations in North County to do outreach and then also stand up vaccination sites in various parts to the communities that you mentioned, Escondido, San Marcos, and Vista in particular. We have 3 stationary sites in those locations that operate 5 days a week, and we also have a number of mobile events that take place on average 3 to 4 per week. We are still continuing to vaccinate first and second doses in those, as well as boosters and children 5 to 11. On an average, countywide, we're giving about 1,700 first doses still, which to me is really meaning we're still getting people in, encouraging. In the North County, it's a bit lower, closer to, well, I have focused on Escondido, and I got numbers that were closer to 70 or 80 a day. We are continuing to do the outreach. We're continuing to see uptake, partnerships that are working quite effectively. We'll continue to work with your office and any of the offices that are interested in partnering with us and exploring options for reaching certain populations that are harder to get due to location or perhaps language barriers.
I appreciate the work. I think what I'm trying to better understand is, I mean, now we can see that those populations have been lagging behind. So I'm wondering, what are the changes that you're making to the work? Are you focusing additional resources or additional staff? Or, you know, I'm really trying to better understand what we're going to do differently to focus on those areas. Not, I mean, I do think we've been doing a lot of work, and my office has been very, very involved in doing that outreach. So we have been doing a lot of work, but I am concerned it's not achieving the results that we need. So I'm wondering what we are planning to do differently in the near future to improve outcomes in these areas.
Through the lens of continuous improvement, we are focusing on trying to understand the barriers that are keeping people from getting vaccinated or reaching vaccine sites. And as we hear from constituents in the areas, focusing on those areas where people want to go, if it's a school or a park. So really focusing on each individual group's specific barriers. I think that is one of the things where we've been able to tailor our approach to that particular community. And we also, that's one of the things that we're continuing to work on. So those are just a continuous improvement process where we identify a barrier and work to overcome it through outreach, whether language, community partnerships, faith-based partnerships and other such initiatives.
Would it be feasible to, I mean, obviously this is time sensitive and we don't have another board meeting for a while, but in the interim, would it be possible to receive a memo back, maybe in the next week or 2 weeks, that detail what you've identified as some of the key barriers to vaccination rates in some of our regions that are, that we're not doing as well as we would hope. Obviously, I'm particularly concerned about Escondido because it's my district, but this is a countywide problem, and I want to make sure we're focusing in all the pockets that are, not seeing vaccination rates that we would hope. So I think the question is whether we could see a memo back that details what are the main barriers we've identified, and what are the changes in program implementation and program design that you all are going to implement in response to those barriers. And I think I'm particularly interested in changes. So if there's things that we've been doing already, great, that's amazing, let's keep doing it. I would love to better understand what are the things that we're going to change in response to these these barriers that we've identified. Would that be feasible?
Yes, that we can do that.
Okay, would I need a motion, or is this? Okay, great. That would be really helpful. I appreciate, again, all your work. I mean, this is a huge priority for my office, and, from day one, just trying to figure out how we overcome these barriers. And I think we've done a great job in a lot of parts of our county, which to me shows that we can do it. We really can do it. And so I'd love to see how we draw on lessons learned, where we have had those successes in the majority of our county, and how do we then apply those to some of these regions?
If I could add just a quick thing, just in support of what you're saying, when you're looking at the information by zip code, just want to highlight that we do have the artificiality of not getting the military vaccine data into our registry. We've worked with our local partners for a long time to try to get that in, but that's a national issue that we can't get the by name information. They give us the numbers, so we know that X number of individuals have been immunized, but we don't know where they live because they won't give us that demographic information. So the places where there are known military populations, you're going to see a structural undercount, and that's something that just needs to be taken into account.
That's actually really helpful. I think that's probably applicable to some extent in Vista, less applicable in Escondido and San Marcos. So.
And if I may, Chair.
That's both DOD and VA. So that's not just active duty military, that's also retired military or any individual who gets their health care through the VA.
And Chair, if I may, just through the leadership of your subcommittee, the COVID subcommittee, we're getting back the results of our third survey. And that's going to also be part of informing what insights we have for other interventions. Just wanted to add that.
I think just adding on in terms of that memo, what would be very helpful when you look at barriers and strategies to overcome those barriers is not only or solely a breakdown by geography, but also within geographies, breakdown by race and ethnicity and language. Because I would hypothesize, based on some of the data I looked at, that, for example, in Escondido, that it's our Latinx population that's significantly under-vaccinated. So it's not a population-wide average, but there's population subgroups that are being left out. Okay. Great, thank you so much.
Vice Chair Vargas.
Thank you. Thank you so much. I just wanted to say thank you for all of the great information and, serving as the COVID Vice Chair. I just did want to emphasize, because I understand that a lot of the data and the requests that you're making are part of your district, but because of a lot of the Latino groups have also reached out and asked a lot of questions specifically to the Latino population, and, I think it's over, 51% is Latino in your district, and over 40% almost 40% speak Spanish. What are lessons learned, I think, and hopefully in this memo that is shared, we can talk about the fact that the numbers are actually moving, because I think it's really important to emphasize that the interventions that we are using are working in these communities, and that the inequities that exist around healthcare exist before COVID. And so we're having to catch up on the fact that so many people didn't even have access to healthcare, and there isn't really a structure in place to access a lot of these resources, whereas in other areas, like you have South County, where some of these were already embedded, that it's a little bit, I don't want to say the word easier because it's not, but the infrastructure is in place for us to be able to execute some of these programs. But I want to make sure that we're continuing to emphasize, I heard, right, that in some cases people were trying to get the boosters and we're prioritizing first vaccines, second vaccines, some of these areas. I know that we've had some successes, particularly in South County. We're still doing really well. At least people, 96.7% have at least one shot. So I think a lot of the information, and then also the various indigenous languages and dialects that may be spoken. I think there's a lot of mistrust of other entities, and so how do we create some of those, break some of those barriers and bringing in some folks that might be able to help us with that. But I know my team will continue to partner up with Supervisor Lawson-Weimer and ensure that in any way we can continue to ask some of the tough questions and see what's actually been working in other areas and make sure that it's shared with everyone else. But anyway, with all of that, I just want to say thank you for all the hard work. It's been a tough year for everyone, and as we're moving into the holiday, hope that people don't let down and just really continue to move this so that 2022 could be a healthy year for everyone. Thank you.
Thank you. Supervisor Desmond.
Thank you. Just on that note, in my district, it got a council member, Maria Nunez, who's in San Marcos, and she's been a part of this Universidad Popular organization. They go door to door in the Hispanic in neighborhoods and Latino neighborhoods, and they go door to door and they can try to convince people to come to get the vaccine. And unfortunately, last Saturday we were overwhelmed. I mean, we had lines of people out there, and it was almost, we didn't have enough staff to handle it. But unfortunately, door-to-door really works in San Marcos, I know, and I know they've been trying to do it in Vista and Escondido as well. Thank you.
Good. Okay, so we have got the 6 recommendations outlined in the board letter. We're adding recommendation 7 around monoclonal treatments. We're adding recommendation 8 around having staff develop some feasibility around increasing testing in the multiple categories that were outlined. And then 9 was adding next COVID update to have a presentation surrounding natural immunity and that in the context of vaccines as well. We've got a motion and a second. What we're going to do first is vote on recommendations 1, 3, 4, 5, 6, 7, 8, 9. So basically every recommendation except number 2. After we vote on this, we will come back and have a standalone vote on recommendation number 2. So right now we're voting on 1, 3, 4, 5, 6, 7, 8, and 9. We have a motion and a second. Please vote.
Chair Fletcher, that motion passes unanimously with all supervisors being present and voting aye.
We are now going to vote on recommendation number 2. We have a motion by myself, second by Vice Chair Vargas. Please vote.
Chair Fletcher, that motion passes with Supervisor Anderson and Supervisor Desmond voting no, all other supervisors being present and voting aye.
We're going to take items 24 and 25 concurrently. They are a similar topic and similar subjects, so we will take the 2 of them together. I'll make a motion to approve the recommendations in items 24 and 25. Is there a second? We have a motion by myself, second by Supervisor Desmond. I believe our clerk needs to read a statement for the record on these items, and then we'll hear from any public speakers.
Thank you, Chair Fletcher. The county, for items 24 and 25, the county has entered into a joint powers authority agreement with the California Enterprise Development Authority, also known as CEDA. CEDA's mission is to support the economic and social development of qualified private organizations by assisting with the issuance of tax-exempt or taxable bonds on behalf of a borrower to finance certain public benefit projects. In order for CEDA to issue tax-exempt bonds on behalf of the borrower, a local agency is required to hold a notice public hearing to satisfy the public approval requirement of Section 147F of the Internal Revenue Code. Today's action will provide CEDA the necessary authorization to issue bonds on behalf of the borrower.
With that, let's call forward our speakers on this item.
Thank you, Chair Fletcher. We have 4 requests to speak on items 24 and 25. We'll begin with the in-person speakers. I'd like to invite forward Audra and Consuelo. And Audra, since you requested to speak on items 24 and 25, you'll be provided 4 minutes.
How fun. That's great. Whoa. Okay, Audra. So just more money to be spending. It's not even your money, it's the people's money. And we're just, spending it on projects that you're going to refinance for construction, improvement, furnishing, all these things, and you can't even complete projects. Yet you've got $16 million here you're going to do over 2 different things, and I mean, it's just a joke. Like, see, I don't understand, Jim, how you can vote to take us out of an emergency, but you still want to implement all of the things that have to do with that. So why would you want to take us out of an emergency then, if you still want to implement all the things? Is it the money? Yeah? I mean, you could nod, because you know that it is, huh? You guys want to, as long as you pretend to want to get us out of the emergency, but we're still in it, funds keep coming in. More money, more buckets. I was wondering, so like, how much do you pay people to call in? I would like to apply for that job and get paid to spew BS. How much are you paying them, Nathan, to call in? $100? Are you putting them up in a hotel for 50 grand a night or month? How much is it? You don't want to answer that because you know I'm right. It's very sad, the state we're in, because you guys just really don't care. And I wonder, why are you in this job? Because once you violate your oath and you abrogate that, you're not even allowed to enjoy the duties of your job. So like all of these votes that you're putting through, like, you're just holding those seats for all of us. You're keeping them warm so that we can come in and make things right the way they should be, the way the people deserve them to be. Uphold the Constitution. Don't violate people's civil liberties, all for the sake of safety. It's like you care about people dying from COVID, but you don't care about the ones that have died from the vaccine. Why can't they just be equally, viewed? Like, say you want to go ahead and say that for the people who have COVID, but don't dismiss the people who have died or are injured from these vaccines. I mean, it's a disgrace to see that happening. And so then I wonder, finding things out about certain people on this board, like Nathan, what was found on your computers in Qualcomm when you were working there? What was on the computer? You know what I'm talking about? Yeah. How old? How old were they? Just curious. It's despicable, the things that we find out about you guys. And then you profess to be these people that want to help us and all this. You're going to be exposed fully, and your family will be ashamed.
Final call for Consuelo. Seeing no movement in the chamber, that concludes public comment on items 24 and 25.
Got a motion and a second. Please vote.
Chair Fletcher, that motion passes unanimously with all supervisors being present and voting aye.
We have one request to speak on closed session matters. Let me ask the clerk to call forward that speaker at this time.
Thank you. We had one request to speak by phone on closed session matters. If that individual could dial into the conference line now using the instructions that were provided to you. Chair Fletcher, I'm not seeing that caller in the queue.
All right, we're going to go to board committee reports. I just want to ask all my colleagues if you have any information you would like to provide at this point about any boards or commissions you may serve on. This would be a good time to do so. All right. Go for it.
Okay. For the San Diego Air Pollution Control District, the board is actually going to be interviewing the final candidates for the executive director position. And so we are looking forward to announcing the new Air Pollution Control District person by January. Let's see, we have the SANDAG on Friday is going to be considering the adoption of Transformer Regional Plan. So we hope that people will participate in that process. And then CSAC, I was at CSAC this last week in Monterey. I was able to actually serve on a panel with our government affairs folks and really just be able to highlight some of the great work that the County of San Diego is doing specifically around ARPA. And then really talk about all the good work that's happening, how we created a framework, and a lot of people were excited, including our work that we're doing around CETA. And as there now is a statewide, coordination that's happening so that we can get it to Congress and get it passed. So those are some of the things that we've been doing.
Thank you. Supervisor Desmond.
Yes, on the Spent Nuclear Fuel Energy Committee, on Tuesday, the U.S. Department of Energy issued a request for information to restart the consent-based siting process for spent nuclear fuel. It's an important step towards removing spent nuclear fuel stored currently at San Onofre, which was not built as a storage facility. Today's the announcement of the going out for a request for information is going to help the nationwide search by engaging communities to possibly get buy-in and better understand what it might mean for them to take to consent to hosting a storage site. So we're looking. So that went out on Tuesday, and we'll see what comes out of it. Thanks.
Thank you. Thank you, Supervisor Desmond. We're going to do our adjournments. After our adjournments, we'll return to remaining non-agendized public speakers. We have 2 adjournments in memory today. Our first adjournment will be from Vice Chair Vargas for Octavio Mendoza.
Thank you, Chair Fletcher. Today I want to adjourn in memory of Octavio Mendoza, a loving son, brother, uncle, and father of an 8-month-old boy and another child on the way. He was full of life, full of laughs, enjoyed making people laugh, and loved the arts. Sadly, he was taken from us way too soon at the age of 40 over the Thanksgiving holiday and was struck while bicycling in a hit-and-run accident. This year, unfortunately, he was the 15th cyclist to be killed in San Diego County. This has been the most fatal year in San Diego County of an unacceptable number of cycling deaths. Our region is committed to working towards eliminating all traffic fatalities and severe injuries while increasing safe, healthy, and equitable mobility choices for all. Safer streets ensure safer neighborhoods. We adjourn today's meeting in Octavio Mendoza's honor and memory and offer our heartfelt condolences to his loving family and many friends.
Our next adjournment will be from Supervisor Desmond honoring Josh Gaffin.
Thank you, Mr. Chair. On October 24th this year, Josh Gaffin died at age 39. He was a deeply beloved son, brother, uncle, and friend, as well as an esteemed member of the San Diego business and civic community. He leaves behind so many broken hearts and many unfulfilled promises. Josh attended Beth Israel Day School and La Jolla Country Day before graduating in 2000 from Torrey Pines High School. His path took him toward the Bay Area, where he and his family were so proud to have him attend UC Berkeley as a pre-med student. During this time, Josh trained as an EMT and spent hours volunteering in local emergency rooms. Eventually, though, the pull of San Diego brought him back home, and he joined GAFCON, the company that his mom and dad, Pam and Hughie Gaffin, founded in 1987. And as was Josh Way's, he began forging his own path here. A big thinker, Josh never shied away from rocking a boat or proclivity towards making his voice heard. As a kid, Josh was the ultimate class clown. And that wit and humor carried throughout his adult years, where he loved a good joke, cackling over many family funny stories, and giving his loved ones a good ribbing. This is not to discount his big, kind heart. Josh had a tough exterior that concealed a caring and sensitive soul. To his family, to his friends, to his dog, to his coworkers, all note that Josh always treated them with respect. And perhaps the only exception to this was during a spirited political debates, one of his favorite activities. His civic contributions bring us here today, and we'd like to pause to acknowledge the contribution Josh has made to the community. Josh was involved in the San Diego Regional Chamber of Commerce, San Diego Taxpayers Association, the Lincoln Club, the 1199 Foundation, and the Construction Managers Association of America. After a nearly 20-year career at GAFCON, beginning with working summer jobs in construction trailers, and in the mid-90s, Josh was both a member of the board of directors and the vice president of special projects. Josh loved being in nature, hunting and fishing, fast cars, his mom's cooking, and was a voracious reader. At this time, though, his unintentional death is a case of suspected fentanyl poisoning. His family is gutted, and that in this national epidemic led to Josh's death. And who should have had a very bright future. His family will find some solace in working towards protecting lives like Josh's going forward. But they wanted to share how deeply touched they are by this moment of recognition and hope that if you have a place in your heart, you will join them in holding Josh there in your hearts. Thank you.
Thank you, Supervisor. I want to join you in the honoring and recognition of the life Josh lived. I had the honor to know him, to be around him, and there was a tremendous spark and interest and excitement every time you were with him. And his death is horrendously tragic. And we know as a parent that the grief that his family must be going through and the pain that they're going through, and the tremendous loss for the entire community, a very young life with so much ahead of him. And it is a reminder for us all to recommit and rededicate ourselves to the efforts to tackle issues of addiction and to ensure that we are providing treatment options in a way that can meet every individual out there so they know that there is hope for them. And so we adjourn our memory today in memory of Josh Gaffin and send our deepest thoughts to his entire family, network of friends, and everyone whose life was touched while he was with us.
And that fentanyl reaches all socioeconomic areas and it devastates families. And as a fellow veteran, today, Pearl Harbor Day. We should absolutely remember all those that gave their lives in Pearl Harbor as well. So, and everybody who's connected to a veteran some way or another. So
thank you. With that, we're going to resume our non-agendized public communication. We'll see how many speakers remain. At the conclusion of non-agendized public communication, we're going to go directly into closed session. We'll get through as much as we can. We won't go super late, and whatever carries over, we'll carry over to tomorrow after open session. But as soon as non-agendized public speakers are done, we will reconvene in closed session and get through as much of it as we can tonight. And so I'll ask the clerk to call forward our final non-agendized public speakers.
Thank you, Chair Fletcher. We have 17 remaining requests to speak on non-agenda items, 5 in person and 12 by phone. We begin with the in-person speakers. As their name is called, please come forward. Jeff Noway, Sandra Martinez, Lana Cotton, Amber Long, and Mark Dorian. If I've called your name, please come forward. Again, you'll have 2 minutes to address the board. For any members of the public that requested to speak by phone on a matter not listed on the agenda, please dial into the conference line now using the instructions that were provided to you. Please come forward.
Mark Dorian. No Marine would ever consider coming home to defend his family with a 10-round magazine and without a good rifle. They all know that running out of ammunition fighting against an enemy is not an option. As a professor, you know that historically, every country that has taken away its citizens' gun rights always ends in tyranny 100% of the time. Admiral Yamamoto was very clear that the reason Japan could not invade the U.S. was not because of its military, but because of the hundreds of millions of well-armed citizens. The Mexican cartel is laughing at the disarmed citizens of California, and the Chinese, who have an army 2/3 the size of the entire U.S. population, can't wait for Biden to finish disarming all of our citizens while arming the Taliban. You have been informed many times that Chicago, with the most severe gun restrictions in the country, has the worst violent crime rate. Criminals prefer a place where the sheep are disarmed or will quickly run out of bullets for their inferior pop guns. And when a criminal is caught murdering someone, they don't care if their gun has numbers or not, or if their ghost gun is illegal. The police know you have only prevented good citizens from being able to defend themselves easier and cheaper. Also informed numerous times that Sweden did no lockdowns and has less than 1/4 of the deaths of Los Angeles County, with the same population of approximately 10 million. Your lockdowns caused 40% of our middle-class businesses to fail, as your over-stringent rules for small businesses will continue to do now. You have been informed that statistically vaccinating children will do much more harm than good. The health misinformation agenda you passed would have silenced the first doctors to speak out about Johnson & Johnson baby powder and Monsanto's Roundup causing cancer. Johnson & Johnson, who make COVID vaccines and cannot be sued for injuring or killing us or our children. Hundreds of citizens stayed from morning until past midnight to stop the destruction of our constitutional rights, which you swore as both a Marine and a supervisor to uphold.
Thank you. Thank you. Next speaker, please.
Lana Cotton. These are the times that try men's souls. In 1776, Thomas Paine's pamphlet sparked the Patriots to declare independence from Great Britain and ignited the revolution. All 56 signers of the Declaration professed faith in God. Did they continue to trust? In 1787, Benjamin Franklin said, "In this situation of this assembly, groping as it were in the dark to find political truth, and scarce able to distinguish it when presented to us, how has it happened that we have not hitherto once thought of humbly applying to the Father of Lights to illuminate our understandings? In the beginning of the contest with Great Britain, when we were sensible of danger, we had daily prayer in this room for the divine protection. Our prayers were heard and they were graciously answered. All of us who were engaged in the struggle must have observed frequent instances of a superintending providence in our favor. To that kind providence we owe this happy opportunity of consulting in peace on the means of establishing our future natural felicity. And have we now forgotten that powerful friend, or do we imagine that we no longer need his assistance? I have lived a long time, and the longer I live, the more convincing proofs I see of this truth, that God governs in the affairs of men. And if a sparrow cannot fall to the ground without his notice, is it probable that an empire can rise without his aid? We have been assured in the sacred writings that except the Lord build, they labor in vain that build it. I firmly believe this, and I also believe that without his concurring aid, we shall succeed in this political building no better than the builders of Babel. We shall be divided by our little partial local interests. Our projects will be confounded, and we ourselves shall become a reproach and a byword to all future ages and nations. I am often anxious about the future of our country. Psalm 11 is for the panicking heart. David kept trusting God in all circumstances. He says, "We will not flee, we will not fear, we will not fret, we will not forget God's faithfulness, and we will not fail because God is with us."
Next speaker, please.
Hi, Sandra Martinez again. You know, we don't agree on a lot of things, right? But I think one thing we can agree on is that bioweapons are bad. And if someone were to submit a child to a bioweapon, that would also be bad. I'm hoping we can at least have that common ground. So I'm going to tell you a story of Ralph Barrick and the University of North Carolina, Chapel Hill. In 2002, the UNC Chapel Hill patented a lab-created infectious replication defective recombinant chimeric structure. According to U.S. federal statutes, that is a bioweapon. A bioweapon, according to the U.S., is something that from nature that has been manipulated to increase effectiveness in human beings. That's why gain-of-function studies became illegal. Currently, children are being injected with this exact bioweapon. It is a recombinant structure and a bioweapon by the U.S. standards. Cardiac events and strokes are already happening. Do you think it's a coincidence that buses have panel ads saying kids have heart attacks, or that pediatricians are being told to expect children with strokes, or that they're trying to blame the increase in heart problems on cannabis? Really? Remember, when using genetically modified material, death usually comes over a long period of time, though there will be some quickly from anaphylaxis and other reactions. Pfizer knew the dangers of these shots, but covered it up. Maddie DeGaray is a 12-year-old girl who volunteered for the trial. She ended up in a wheelchair with a feeding tube and other complications. The Pfizer adverse events listed her as having a stomach ache, nothing else. Her testimony was scrubbed from the internet at the panel hearing.
Thank you. Next speaker, please.
Good afternoon, Board of Tyrants. My name is Amber Long. I was born and raised in San Diego County. I am from Vista, California. Fun fact, my parents went to school with your wife, Fletcher. I am one of the many constituents who has lost all faith in our local government. You asked me to trust you as you strip my and my child's rights away. As a citizen, it is not my duty to trust you. It is my duty to question you and make sure you stay in your place. But as of today, you are overstepping your powers. Our heroes no longer have bodily autonomy. Our heroes who don't question who you are, what your beliefs are, what your political affiliation is, what lifelong and possibly contagious diseases you have. They don't question any of this, but instead they jump into danger to save you. These heroes who put their lives on the line are being told that they don't have bodily autonomy. You guys are tyrants, doing what tyrants do best, and taking away basic human rights. Martin Luther King Jr., the ultimate measure of a man is not where he stands in the moments of comfort and convenience, but where he stands at the times of challenge and controversy. Next quote. The hope of a secure and livable world lies with disciplined nonconformists who are dedicated to justice, peace, and brotherhood. Next quote. If any earthly institution or custom conflicts with God's will, it is your Christian duty to oppose it. You must never allow the transitory, evanescent demands of man-made institutions to take precedence over the eternal demands of the Almighty God. And Jim Desmond, everything you just suggested was downright disappointing. I don't know how else to say it then. I do not consent, and I will not comply. I don't want to be a part of your system.
Final call for Jeff No Way. We'll now hear from those that requested to speak by phone. When it is your turn to speak, you'll be unmuted and you will hear a recording that will tell you to begin your comments after the beep. I would remind the callers that they should mute their TV or live video stream before they begin speaking. We'll begin with our first caller.
Good afternoon, Supervisors. Kathleen Lippett here. A recent article in The Guardian, a respected English newspaper, highlighted many of the marijuana legalization problems in California over the last 5 years. They reported that experts state that 80 to 90% of the market remains underground due to a combination of failed enforcement efforts and a naive hope of regulating an industry that profits from drug abuse and addiction. Marijuana businesses, unpermitted and permitted, use their deep pockets to influence local, state, and federal government leaders, as well as the regulatory support structures behind them. The illegal businesses today are the fifth largest economy in California and increasingly have the capitalization to purchase legally permitted businesses. Today, state licensed businesses must keep 1 foot in the illegal and unlicensed market to stay profitable. That's their quote. In the meantime, there is no recognition of the first-order victims, the young, the marginalized, and the low-income communities devastated by rampant drug dealing, abuse, and addiction. We should remember that today's marijuana pot shop applicants still prefer going back and re-victimizing the same communities, low-income and minorities, that they once were predators of. Marijuana is not a natural plant anymore. It is a highly hybridized, manufactured drug that bears no resemblance to the plant of the 2050s and 60s and 70s. Thank you very much for letting me speak.
Thank you. Now hear from the next caller.
Hi, my name is Carol Green, and I wanted to let you know that in the past I have shared with you
my personal story of marijuana nexus with psychosis. And I've shared with you the impact of marijuana and mental health, particularly on young people, teens, and young adults. But previously, I've told you about my family's experience. But today, I wanted you to know how your decisions are impacting the mental health of these young people, and particularly since you were just talking about this very tragic fentanyl death and our addiction with drugs. I want you to know that a RAND Corporation study of 1,887 people, ages 18 to 22, lived in Los Angeles, showed that if they lived in a neighborhood with a higher number of marijuana storefronts, they were more likely to use marijuana. And they used pot more frequently and had more positive view about the drug because of the more storefronts in their neighborhood. The more access equals more exposure. So you say, well, it's legal and regulating will keep it as a black market. Absolutely not true. And even the county's own staff will tell you that studies and actual statistics and information about whether this is true are conflicting. Recently, 700 illegal permitted cannabis storefronts in California were evaluated between June 2019 and September 2019. They showed that 67.9% of these shops failed to comply with California law requiring age limit signage, just the signage. 35.3% broke the law by having marketing items that appealed to young people in their stores. And this occurred just last year, right before the pandemic, so this is not an old study. Furthermore, there is no evidence that more shops slows down the black market. Thank you.
Thank you. Now hear from the next caller.
Hi again, it's Paul Henkin. I wanted to let you know that most cases of COVID-0, the Omicron variant, most cases in the United States have been in fully vaccinated people who only experience mild symptoms. So, my question to you, Wilma, is may we call it a plague of the vaccinated? And I'll take my answer on the air. But I guess none is forthcoming. So, thank you. And I hope you don't talk so much during the consent items next time, by the way. That, I don't know why you restricted us from commenting on the consent items, but then you gaz on and on. It's not really fair to anyone. Thanks.
Thank you. Now we'll hear from the final caller.
Good afternoon, County Supervisors. My name is Becky Ratt. I'm a parent and youth mentor. I'm here today to express my deep concern for the quickly evolving marijuana ordinance the county is choosing to move forward with regardless of the public's outcry against this expansion. As supervisors, you need to be fully aware of the negative impacts that will be had on our neighborhoods and communities. We parents know the negative impacts as we have seen firsthand what has happened in cities within the county and in the unincorporated region. In the city of San Diego, it has become obvious there's a significant lack of oversight and inability to enforce the law when it comes to marijuana businesses. Code has been trampled and ignored. I saw this damage to public properties firsthand. When over the Thanksgiving weekend, I visited Mission Beach with my family as my son had a basketball tournament nearby. I was shocked to see the illegal marijuana sales blatantly going on along the boardwalk near Belmont Park. In contacting nearby law enforcement, they were unable to act. If the city of San Diego has difficulty enforcing the law at a popular tourist attraction, then how does the county plan to enforce the law in small, backcountry communities? These communities need basic necessities such as public transit, efficient emergency response, and internet access. They do not want pot shops. Thank you.
Thank you. And Chair Fletcher, that concludes the request under non-agenda public communication this afternoon.
Thank you. That concludes the business before the board today. We will adjourn into closed session. Thank you, everyone.
The board will now recess into closed session to consider those matters listed under item 27 on today's agenda. If there are any reportable actions, they will be reported out during the planning and land use session of this meeting tomorrow, Wednesday, December 8th, 2021.